I know that folks are still making their way into the building, but we're going to go ahead and start our program. Bienvenidas, bienvenidos y bienvenides. My name is Berta Alicia Guerrero, and I have the pleasure to serve as the Director of Intergovernmental and External Affairs here at the Department of Health and Human Services. It is my pleasure to welcome you to the second annual HHS Hispanic Health Summit, Fortaleciendo Nuestra Salud. Fortaleza. It's a beautiful word in Spanish. It means strength. But like any word in Spanish, it is so much more deeper than that. It's not just any kind of strength. It is the enduring type. It is the strength that does not fade when life gets difficult, when challenges seem too big, and when the road ahead feels uncertain. I see fortaleza in my parents, Juan y Irma Guerrero, who immigrated to this country, with a sense of optimism and faith that this nation would provide opportunities, and who instilled in me a sense of responsibility to help those who have the least. Throughout Secretary Xavier Becerra's travels, I see that fortaleza in communities across the country. In Phoenix, in the home of Raul and Maren Carrasco, two caretakers who work day in, day out in dignity, providing and taking care of folks who need health care services. In Miami, with Hispanic Federation at the Barucan Health Care Center, where seniors are learning how to use iPhones to order their medicine, to learn that it is their right and the law to pay no more than $35 for insulin. I see it in Albuquerque, New Mexico, with medical students and residents from the University of the New Mexico School of Medicine who are choosing to go into maternal health care and become OBGYNs, despite the attacks on reproductive rights across this country, because everyone, women included, deserves access to care no matter where they live. I see it in Los Angeles with Chirla, who's fighting to ensure that the rights of immigrants are protected and they have access to care. And we look forward for the first time to have eligible DACA beneficiaries enroll under the Affordable Health Care Act this November. Thank you. It's a big accomplishment, folks. And I see that fortaleza in this room, in all of you, in your workplaces and in your communities. When it gets tough, you find the fortaleza to rise time and time again. Today, as you hear from our speakers, remember to embrace your fortaleza. It is in all of us, and with that, we can overcome anything. And without further delay, it is my pleasure to introduce to you the 25th Secretary of the Department of Health and Human Services and the first Latino Secretary, Xavier Becerra.
Wow, you guys had your coffee. That's good. Gracias. Well, good to see. Wow. What day's today? You look like you think it's Friday night and you're getting ready. You know, I had thought about telling the team, instead of calling this HHS's second summit, the HHS second summit, Fortaleza a Nuestra Salud, I thought maybe HHS's second pachanga, because it would get across the point. We want to have a good time here, but I was overruled, so we will discuss Nuestra Salud. Can I say first, welcome to all of you. I know that Surgeon General Diana Ramos is in the audience from California, so I know that, where are you, Diana? I just saw, there you are right here. So I know we have some folks from across the country. How many of you are coming from west of the Mississippi? Excellent. How many of you are coming from outside of Washington, D.C.? Even better, even better. Okay, so who's here from the D.C. metropolitan area? Okay, good, good. So you all don't get any more coffee. You guys are fine. We want to thank you for coming today to our second summit. We hope that moving forward, HHS every year, especially during Hispanic Heritage Month, will host a summit on Nuestra Salud. And we hope that you will come, you will encourage others to join, and that we can make this an annual affair. And maybe at some point we will make it into a pachanga. But until then, we will continue to give you an opportunity to express yourselves when it comes to what we must do to better the health of all Americans, and certainly our communities that always are working hard, but sometimes not having access to the care that they need. To be Guerrero and her team from our external affairs shop, who makes it possible for all of you to be here, I say thank you for the tremendous work that they do. You're going to hear from a number of our principals at HHS on many, many subjects. We're proud that we have perhaps the most diverse department of our 90,000+ people. We have one of the most diverse departments. I suspect we have one of the largest contingents of Americans of Latino descent at the Department of HHS, and we're very proud that we seek out diversity. If you're looking for a job, keep us in mind. We would love to have as many of you come, especially west of the Mississippi. Everything's so eastern seaboard here in Washington, D.C. We need to have people from all across America, so we hope you'll consider making this a destination point for you. Congresswoman Nanette Barragan, the chair of the Congressional Hispanic Caucus, will be addressing you later, and I thank her in advance. You're also going to hear from Emmy Ruiz, who is the Director of Political Strategy and Outreach at the White House. Important to have her here because she can tell you what's on the horizon. And that's, I think, everyone's interest right now is where will we be heading? And it is phenomenal that Emmy is taking the time to be here with us. I mentioned Diana Ramos, the Surgeon General. I know many of you coming from different parts of the country, from very important positions, and I thank you for being part of today's summit. Probably two things I want to get across to you. This summit, your being here, the work that we're doing, you know, we're lucky that today there are more Americans who have health insurance than ever in the history of the country. More than 300 million people today have coverage and have access to a physician, a hospital, because they don't have to beg for their care. They don't have to wait for the charity to be offered. They walk in knowing that they have their own insurance, private or public, but it's theirs. And they can walk in and get the care that they need. Never in the history of the country we had more than 300 million people who can do that. There are more Latinos in our history who today have access to health care. That's right. And the Affordable Care Act, which has had to survive more than 100 attempts to repeal it, and which I had to defend to the Supreme Court of the United States, and won, because it's still around, before. Today, there are 46 million Americans who have their health care as a result of the Affordable Care Act. 21.5 million through the marketplaces throughout the country, and another 25 million or so through Medicaid expansion. And so it has been a phenomenal success. There is no community of color that is a higher participant in the Affordable Care Act marketplaces than the Latino community. There is a record number today of Americans of Latino descent who have their health care through Obamacare. And that was going in the opposite direction with the previous administration. When we came into office, the previous administration had let the numbers drop to under 12 million people who had coverage through the marketplaces. Today, we're almost double that number, and it's principally because Black and Latinos have come forward to accept the coverage because we went to them. We didn't wait for them to come to us. And so my first point I want to make to you is that none of these things are luck. They are not coincidence, nor are they easy. It was intentional that we went out and sought people in the Black and Latino community to get enrolled because we had a great plan. They just weren't always aware of it. No one was reaching out to them. The previous administration had cut the navigators that help people understand the Affordable Care Act. We have more than increased by over $100 million the funding for navigators to make sure people can be reached. That's intentional. It is intentional that we are at almost 700 million vaccines that have gone into the arms of Americans during this time of pandemic and COVID. Nearly 700 million. But the best part about that, because it was intentional, not a single American had to pay a single penny for that vaccine. How many people would not have taken that vaccine had you told them it's going to cost you $200? Because that's what it's going to cost now, because Congress swept up the money we had for the program I created, Bridge Access Program, to make sure the underinsured and the uninsured continue to have access to COVID vaccines, regardless of what happened with a public health emergency once it was put down. We put aside a bit more than $1 billion to reach the under or uninsured, mostly in the Black and Latino, Asian community, Native American community. That got taken from us by Congress. And so today, unless you are insured, or unless you know a good FQHC, you may have to pay $200 to get that vaccine. Do the math. Nearly 700 million vaccine shots already in the arms of Americans. No one had to pay $200 to get it. That was intentional. We're doing things here because we intend to have them happen. We hope you'll join us because we're not waiting for luck. The other word I wanted to mention to you is special to me, and if you've ever heard me make any remarks, I rarely go an opportunity without mentioning what my mom taught me when I was a kid. That didn't make sense to me much when I was little, but today does. Mijito, mejor prevenir que remediar. Son, it's always better to prevent than to remediate. And today, I live that. That is exactly what we're trying to do. At HHS, we're trying to turn our healthcare system, which is a system for treating illness, into a system for promoting wellness. Because we don't want to wait. I always, along with quoting my mom as a great American, the second great American I quote is Frederick Douglass. It is easier to build strong children than to repair broken men. We're repairing a whole bunch of broken men and women right now with our healthcare system, when we should be spending that money to build strong children from the very beginning. Prevención, prevention. We can do this. That's why at HHS, we've taken on the mantle of food is medicine. So that instead of telling a kid that your child has to pop some pills to reduce weight, or telling people that they've got some surgery they can do to help them with their health, we tell them there are fruits and nuts and berries and vegetables that you can get at a discount price, because I'm going to give you some script, a prescription that you can take to that grocery store, and you're going to get an automatic 30% discount when you buy that food. Food is medicine, because it really is. If you talk to the curanderos, if you talk to many of the healers in the Native American communities, they'll tell you, of course. We've always taught that. Prevención. We want to prevent rather than remediate. We hope you'll join us in that effort, because that's what it takes to make sure that we're doing the right thing. And so whether it was in making sure that we got as many people insured as possible to record numbers to prevent more illness, and doing it intentionally by reaching them before they had to worry about where we were, if it was standing up the 988 suicide and crisis lifeline that is now up and running nationally, so that if you are in real hurt, you don't call 911 anymore, you call 988. 988 is the national number we just stood up. And yesterday, by the way, we announced that we finally are getting geo-routing, which means that if you've got like me, a 310 area code on your cell phone, because I'm from LA, and if I call and say, I need some help, I'm about to go the wrong way in this road, the wrong fork in the road, someone doesn't say, okay, Javier, we're about to send someone to you. Stay put. We're going to send someone to you in Los Angeles. When I'm in D.C., that's not going to help me. So with geo-routing, we'll be able to do the geolocation to make sure that even though I have a 310 area code phone number, they know I'm in Washington, D.C. And so we stood that up. The year before we came in, the previous administration had spent $22 million to make sure 988 could go national. In a little bit more than 3 years, we've spent about $500 million each year, $1.5 billion to stand up 988, because that's what it was going to take to get 50 states to come on board to have the call centers and make it available. And that's why we can do it with a dedicated line if you're a veteran. That's why we can do it in Spanish if you call and say, necesito ayuda en español. That's why we can do it for those who are hearing impaired. That's why we can help those who are LGBTQ. That's why we're making it possible for tribes to get service on 988 from someone who recognizes them in parts of the country. That's intentional. That is to prevent. And so I will close by mentioning two other things that I am personally very proud of what we have done. B mentioned that we have now extended access to Obamacare to our dreamers. And that was a long fight, because not only was there an effort all the way to the Supreme Court to undo the Affordable Care Act, but there was an effort, which as I said, I want to don't forget, I took it to the Supreme Court. I got to remember, because people forget that when I was AG in California, we had to preserve the Affordable Care Act because Donald Trump would not defend it. Even though he was president and it's a federal program, he would not defend it. He walked out of the case. We knew he would walk out of the case, so when I was AG in California, I petitioned the courts to let us go in and defend the ACA, and they allowed us to go in. That's why we took it all the way to the Supreme Court instead of the federal government, and we won. But DACA, if you recall, about 4 or 5 years ago, that administration tried to kill DACA as well. And because the federal government wouldn't defend its own program, we stepped in and we sued. We took that all the way to the Supreme Court, and we won in the U.S. Supreme Court in defending DACA. So it gives me great pride now as the Secretary of Health and Human Services to be able to follow up the defense of DACA as Attorney General, to now say, under our leadership at HHS, we have extended the Affordable Care Act to dreamers as well. And so I am very proud of that, because I tell you, that was intentional. And the final thing I wanted to mention to you, because it's very personal as well, is that we are now trying to do what we can to protect farm workers and people who work outdoors from extreme heat and from wildfire smoke. Because if you know the law, farm workers are still excluded from protections under the National Labor Relations Act. In the state of California, we have a California Labor Relations Act that protects them to some degree, but still not enough. My dad was a farm worker, and I know how hard it is when you have to work outside in these hot days, and we should be doing everything we can to stop extreme heat exposure from killing Americans, because it does every year now. And so we're moving at HHS to work with the Department of Labor, EPA, to do as much as we can so that everyone who works hard to build this country knows that we are intentional in our efforts to protect you, prevent you from becoming ill. And I hope that you will take on that mantle of being intentional in what we do and helping us prevent illness by promoting wellness. So help us. I hope you're here to join us, and some point maybe we will turn this into a pachanga before the night is over. Thank you all very much. I turn it over now to Eduardo.
All right, buenos dias. Welcome to HHS and this Health Summit. Before the pachanga, let's jump right into some of the great panelists and special guest speakers that you have here this morning. My name is Eduardo Cisneros. I'm the Principal Deputy Director for the Office of Intergovernmental and External Affairs here at HHS in the Office of Secretary Becerra. Actually, I should remind folks, if they haven't already, a couple of housekeeping things. There's conchas and café back there in the back in the east wing. It's around the corner to my right. And then if you need restrooms, they are on the left side, to my left, on past the elevator bank. So please make yourselves at home. But other than that, oh, and actually two other things. Actually, if you guys want to post and amplify this on social media, we do have our hashtag, which is HHS Hispanic Health Summit on social media. And then we are also live streaming this today, and it's actually also captioned in Spanish as well. So please get the word out. It's a real pleasure to have you all here today. And let me get started with the first panel, which building on Secretary Becerra's point around expanding access to our communities. As he mentioned, under the Affordable Care Act, more people in this country have been covered with health care than ever before in the history of our country. And now we've been able to expand that even further to DACA recipients. And so with that, we're going to bring up the first panelist. The panel is called Bridges. We've built expanding access to the Hispanic Latino communities. And the purpose of this panel, again, is to discuss the expansion of healthcare coverage to Latino communities, and again, including that final rule expanding ACA coverage to DACA recipients. So why don't we go ahead and bring our panelists on up, and I'll hand it over to our moderator here. Thank you again.
Good morning, buenos dias. So this is a very important conversation, as Secretary Becerra just stated, and Edward, thank you for the introduction. We have some amazing individuals here that could speak to just exactly that in terms of outreach and access, and really the fundamental thoughtfulness about doing that, especially with a group that we all believe has been marginalized for way too long and overdue, and so we appreciate the leadership there. But before we kick things off, I'd like to just introduce our panel here. Dr. Muntz, if you wouldn't mind, just give us a quick little summary bio about yourself. Your resume is extensive, and we could probably be here for the next 5 hours, the amazing work you've done, but if you could just share with us briefly, and then we'll go around the panel here in just a second.
Is this on? Or? Yes,
Yep.
It is. Hi. Good morning, everyone. Gloomy day outside, but lots of smiling faces inside. Really happy to be here. Ellen Montz. I am the director of CISAIO, the Center for Consumer Information and Insurance Oversight. What is that? Don't ignore the title. I run the marketplaces. Obamacare, which we'll talk about a lot today. Previous to working in this administration, I worked in the Obama administration when the Affordable Care Act was launched, and it just feels so delightful to be here and continue to build on it with all of you in the room.
Thank you. And Ms. Quesada?
Yes. Hi, folks. My name is Dania Quesada. I am a 3L, a third-year law student at the University of Washington School of Law. I am also a DACA recipient, and I have been since the inception of the program more than a decade ago. And thank you so much for being here and for your willingness to listen a bit about my personal story and about how this major success is truly going to be a life-changing opportunity for myself and for many in my community. Thank you.
Thank you, Danny, for being here. And Ms. Cabrera Solano?
Good morning. My name is Ruth Cabrera Solano. I am a senior health navigator, supervisor at Legal Aid Justice Center under the program Enroll Virginia. I have been working as a navigator for 10 years, and it's the most beautiful work that I can do, and I will never change it, to see how we can help people to have access to health insurance, to health, and thank you for having me here.
Great. Well, thank you guys for being here. I know it's nerve-wracking, so if you guys can help me, just give them a round of applause for being here. Thank you so much. You know, so what we have here in front of us is really the whole swath in terms of straight leadership from the highest levels of government down to the navigators that are doing the work and the recipients, consumers, and you don't often see that type of a panel and opportunity to really listen to how policies are being enacted, how it's embraced by the community, et cetera. But it all starts with policy. So Dr. Muntz, if you wouldn't mind, please sharing us a little bit about the work that's taken place here recently.
Yeah, I want to just start with kind of celebrating with you all in the room, and then we'll get to what's next and more to come. As you all know and have seen and we have celebrated, under the Biden-Harris administration, we've had an incredible growth in health insurance coverage, particularly in the marketplace. We're at an all-time high and have had incredible gains. And so how have we gotten here? Well, how do you get anyone to sign up for something that is good, right? You make it, you make our health insurance affordable. It's a quality product. You actually tell people about it, and then you help them sign up. And so on the first piece, I want to call out that thanks to the Inflation Reduction Act, we have the highest affordability of marketplace plans that we have ever seen, and that has truly driven that increase in enrollment that we have seen since 2020. We've almost doubled enrollment in the marketplace since 2020 under the Biden-Harris administration, and we have more than doubled the number of Latinos that have coverage in the marketplace since the beginning of the Biden-Harris administration. And so that growth and specifically in the Latino population, they now represent almost 30% of enrollment in the marketplace, and we're really excited about that. The second piece is we tell people about this coverage. And what we are doing is we are investing more than ever before in reaching communities that we haven't had as much success with in the past, and we do that with advertising, and we learn each year, and each year we're looking at that micro data, trying to figure out, and we learn, and we do that with our ground game, with our navigators, largest investment that we've had with our navigators in the history of our program. And the third piece is making it easier to sign up. And how have we done that? One, again, we've had a nice investment with our Navigator program. We've done a lot of training with our agents and brokers, with our in-person assisters, and we have also done kind of more technical things in the system to make kind of real-time verification more of a reality. We've worked really hard on helping improve those coverage transitions across programs within the Center for Medicare and Medicaid Services. So specifically, we've done a lot of work with our colleagues in Medicaid to make that transition between Medicaid and the marketplace, that is a very common occurrence, happen more seamlessly. I think later on I'll probably talk about more specifics to the change we made for the DACA population, but wanted to take this time to really celebrate all the gains that we have made before we turn to how we go the last mile.
Perfect. Thank you, Dr. Muntz. The amount of investments that the Biden-Harris and before, of course, the Obamacare, the amount of investments that have gone into our communities to do the amount of outreach. It's something at times in terms of policy to have a vision, but actually to go into those communities, to start building that trust, to get the programs off and going, fall often, as you stated, to navigators, right, that are doing that outreach. And so question to you, Ms. Cabrera Solana, how's your organization involved in terms of doing the outreach and enrollment efforts to get into the Latino communities?
Well, we have been doing the outreach, focusing on the Latino community. We have been hiring bilingual health navigators that can gain the trust of the community. Is the system is hard to understand, but when you explain it in your own language, that is most understanding. So it's difficult, and we have been partners. We have been in partnership with hospitals, with clinics, with community service for the Hispanics. So we are there trying to go into there. For example, I'm gonna give my example. I go to a free clinic for pregnant women. So I go there and I evaluate them to see what they qualify for, and we sit there. We also, we are training our partners for them to understand the difference between Medicaid and ACA, so they just understand. We don't ask the partners to do the screening, we just ask them, could you please refer them to us, because we are the ones that we're going to help them to figure out. And one of the things that we do also is our training is, the immigration, just some people is so complicated, It's even understand what legal status do I have and everything. So when we do outreach, we've mentioned like, we are here to help you to have access to medical services, regardless your legal status. So come to us, and we are the one that we're gonna tell you which program you qualify. And the wonderful thing for us as navigators is not only to say, well, you don't qualify for Medicaid, you don't qualify for ACA, there is no hope for you, bye-bye. No, we're trying to figure out what other resources are in the community. So when a person came to us that doesn't qualify for Medicaid, doesn't qualify for ACA, we can send them to a free clinic, to a low-cost clinic, or even help them to apply for financial aid at this hospital, for charity. So that's what we are doing.
I could already tell by the passion she has in her voice. She loves what she does. And I think that's another piece, is finding people that understand it and are able to translate very complicated language, and not only translate it from English to Spanish, but also understand all the other things that surround those types of complicated questions that our communities often face. Thank you, Dr. Goda. To you now, this is why we're here, right? Is really the amount of outreach to go from policy to training individuals to actually going to the recipients. And let's talk about the ACA-DACA if you can.
Yeah, sure thing. So just to provide a bit of context for the significance of the final rule as it regards to DACA recipients and the ACA. As I mentioned before, I have been a DACA recipient since the program's inception back in 2012. And it wasn't long after that I went off to college, and it was while I was at college that I had access to medical insurance, consistent, full coverage for the first time in a very, very long time. It was also in college, because of the stress that is naturally associated with that particular environment, that I really began to struggle. Mental health in our culture it's a bit of a taboo, if it is acknowledged to begin with. And it was a very difficult experience, and it took me a very long time to recognize that at the basis of this suffering was a medical issue. Fortunately, because I had access to healthcare, I was able to see a mental health care professional for the first time in my life, and I was diagnosed with obsessive compulsive disorder, OCD, and I began to take psychiatric medication, To say that this intervention was life-saving, I think is a bit of an understatement. I cannot describe how difficult my day-to-day life was, and it was all inside of my mind. And I truly didn't know how to ask for help, because I didn't know what it was that I needed help with. Once I was able to become connected with a doctor, and I was able to consistently access my medication, and it was affordable, and I was able to receive consistent treatment, the change in my quality of life was staggering. I truly can't put it into words. I want that for the rest of my community. The problem is that oftentimes, even when there are resources available, access to those resources is hindered because of a lack of know-how. This is why it is so important to have amazing, passionate advocates working behind the scenes to ensure that we are connected to those resources, and why it is so significant for folks who are in positions of power to also advocate on our behalf to ensure that we have access to those resources. And I don't mean simply just being eligible for them, I mean making them a reality. Healthcare is expensive. I was able to afford my health insurance because my school was gracious enough to give me financial aid to purchase it. Once I left school and I started working full-time, I had access to health insurance through my employer. And now I'm in law school. I've been in law school for 2 years. I have 1 more year to go. I'm very excited. But thank you. Thank you. I bring it up to emphasize the bit of a pickle that I found myself in when I moved to Washington to start law school. In Washington, up until very recently, DACA recipients were not eligible to enroll in Apple Healthcare, which is Washington's public healthcare offerings for folks who cannot afford private insurance or who just don't have access to it. Like I mentioned, I've been taking psychiatric medication for a couple of years now, and I remember the panic that I experienced trying to figure out how in the world I was going to maintain access to this medication that enabled me to get up every morning, to face the world, to engage with my studies, and to thrive. I found some pretty creative solutions involving this student health clinic on campus, but when I say it is the bare minimum, I mean it. It is the bare minimum. And unfortunately, there have been situations that have occurred in which I just can't, I haven't been able to see a doctor. And I've been having to deal with that on my own. And it is very unpleasant. All of this to say, I am so incredibly excited. And I am so incredibly grateful and in awe of everyone here, and especially of the folks sitting on either side of me. I am a firm believer that no one is better to advocate for her own health than yourself. Yeah. It's just that sometimes it helps to have a bit of medical guidance. Yeah. I very much look forward to November 1st. I very much look forward to working with a healthcare navigator in Washington to ensure that I'm able to access the best plan for me and to continue thriving. And I wouldn't be able to do that if it weren't for the combined efforts of everyone in this room, but again, especially of the people sitting on either side of me. Thank you.
That's awesome. Thank you. Just want to thank you, Ms. Casaseda, for just sharing that story. It's one thing, as we all know, in the communities that we serve, day in and day out, someone to be able to come forward not only just to share their primary care concerns, but their mental health concerns as we all continue to fight that stigma in our communities. So thank you for sharing that. Dr. Muntz, back to you. The final rule, it's huge. November 1st is a Super Bowl for many folks, and it's a light at the end of the tunnel. Share with us a little bit more about the final rule, if you can, please.
We are so excited to be implementing the final rule that we put out in May. You know, I began with a discussion of the celebration of how far we have come with you all, and now I mentioned at the end we have a lot more to go. And one of those pieces, those critical pieces to the a lot more to go, is that prior to the finalization of our CMS's final rule in May, DACA recipients were specifically excluded from the definition of lawfully present as it relates to eligibility for marketplace plans, including eligibility for the premium tax credits and cost sharing reductions that come along with eligibility for the marketplace. And what we did in this final rule is we removed that exclusion. What we had seen and what we had heard from you all, what we had seen in the data, is that while many DACA recipients had coverage through their employers or maybe a school, far too many did not. And it remained a very glaring hole that we had that we had the ability to fix. And we did that through the final rule. And so starting on November 1st, DACA recipients can come to healthcare.gov, go to a navigator, find that assistance, and get covered. And so we are incredibly excited about that, and we have done a lot of preparing for that. So let me just go through a couple of things that we are doing in preparation for that November 1. First, we are on healthcare.gov. So if anyone who wants to go to healthcare.gov themselves, we're going to have a special text for folks that will kind of call out, if you're a DACA recipient, this means you. This is how you do it. Two, our top priority is working with our partners to help ensure that DACA recipients understand their eligibility and get connected to those folks who can help them work through the difficulties of the complexities of eligibility there. So partnerships, one, of course, with all of you in the room. We really look forward to partnering with you, getting out the word. We've partnered with the Department of Homeland Security. We have heard from DACA recipients that DHS is a trusted source of information. So we have partnered with them to get out the word about new eligibility for marketplace enrollment. We've also partnered with our colleagues at the Department of Education for outreach to students, and at the Administration for Children and Families, and at health centers across the country. As I mentioned, we've done a lot of partnership, and we'll do more with our navigators and our in-person assisters across the country, developing trainings. Each of our navigator programs across the country, many of them, if not almost all of them, have specific outreach planned for DACA recipients this coming open enrollment, and we'll publish two more things. One, a kind of specific job aid, which we publish for particular populations to really help them go step by step through the application process, and some upcoming partner toolkits that we hope that all of our partners will embrace and use in helping sign DACA recipients up for coverage. We could not be more excited. There's a lot of work to be done, and we really look forward to the partnership in this room and ensuring that those individuals who remain uninsured but are now eligible for marketplace coverage get that often life-changing and life-saving coverage, and couldn't be happier to get to deliver that.
Thank you, Dr. Muntz. Ms. Cabrera Solano, so now we heard, right from the Gov, right? Nos van a ayudar. And so now that you have that extra tool to help reach out to the community, what are how are you guys preparing for your organization for the outreach efforts?
Well, as I mentioned before, we are getting trained as navigators. We are training partners. We are making more partnerships, trying to be there where the community is. That's part of our success and in the outreach, because when, for example, when people came to a clinic, they already trust the clinic. They already trust, and when we are sitting at the clinic, sometimes they believe that we are part of them. They don't understand the difference, but that is the way that we build the trust with them, and we are doing that. We are going to schools. We are going to the clinics. Different places. Sometimes we go to supermarkets. Believe it or not, we sit down there in the supermarkets to talk. We ask, can you provide a table for us? And they provide the table for us. We sit there to talk to the people, to advertise about the clinic. And as I mentioned, we don't go specific to this status because it's confusing, but we are doing one-on-one. That's the easiest way. And of course, when they know that, oh my God, I can receive this help, they're gonna spread the word. And that's the best outreach that we have. People are spreading the word, like, she was able to help me, she was able to, and sometimes I ask, like, how do you hear from us? Oh, a friend of mine referred me to you, a friend of mine, and sometimes they didn't even know they qualify. And this is a beautiful thing, but we need to be where the people is. We need to be there, speaking their language, providing resources in their language, and Spanish, providing so they can really understand. And one of the things, when you start talking and you start talking specific about their situation, and you start saying, look, I understand what you're going through. I am immigrant too. And I know, because sometimes they are scared of public charge. They feel that they cannot do it. Please don't, I don't want, and they get scared. And sometimes it takes a process. So we have resources then to understand that they are not public charge. Here is what you are entitled to receive. So that's the way that we do it. And that's the way we gain the trust. Being able to explain their situation and go from there, and that's it.
I love that. I love the idea and the fact that in my experience is that we can't always treat these as just small campaigns, that they're a 3-month or 4-month or 6-month kind of a campaign to do outreach, that it's continuous, because things constantly change. They're always changing. I see a lot of nods in the audience because you know what I mean. Sometimes you get this amount of funds that get brought into a community and say, let's do the outreach, and you hit it hard, and then se va. Right? And then you got to hit it hard again, and so there's constant changes of things. Get frustrating and tedious, but it's important to make sure that you have people on the ground like Ruth here that does it constantly, that understands the complexities, and is doing the outreach to build that trust. Ms. Quesada, explain and share with us a little bit what you're hearing from your peers about what's the changes and hopefully the excitement, hopefully, as to now that they may receive coverage.
Yeah, sure. Generally, I've seen a lot of cautious hope. I think that it's fair to say from the other DACA recipients that I know, and we know each other for the most part, it is a very cautious hope. DACA itself is a life-changing opportunity. It provides life-changing protections from enforcement action, and it also provides employment authorization, which just opens up a world of opportunities for the betterment of one's life. For those of us who don't have access to health care through our employer, this is it, I think. I know that oftentimes we've had to rely on limited resources available, such as community health care clinics, or limited medical services afforded through our schools, such as is my case. I've also, I get the sense that a lot of folks are very confused, are confused about whether they even are eligible to partake in this particular opportunity, and if so, how. But as is, I think, a key characteristic of the immigrant community, even when things are scary and when things are difficult, we show up, and we show up for each other, and that is just evident, especially listening to Ruth describe her work and the passion that drives her. We know that this is an opportunity that is now available, and we are talking amongst ourselves, and we are looking for guidance from trusted sources, such as the USCIS as it regards, for example, to the public charge rule, and other government websites that can provide specific instructions on how exactly to go about doing this. So there is confusion, but there's also a lot of hope and a lot of trust and a lot of reliance in the community itself that we are going to come together and figure this out, as we always do.
Thank you for sharing that. It kind of brings, I've heard 2 different times now from both yourself and Ms. Solano, is the public charge piece. And as the CEO of an FQ in Nevada, where we have a little over 31,000 patients, it's real, it's life. We have an amazing opportunity on November 1st to have the ACA come in place, right? The ACA-DACA opportunity to find a rule. But those are real scenarios, is the building of trust. We're in the middle of campaigns all over the place, you can't deny that. But so how do we continue to build that? What's some challenges without losing out on the opportunities? How are you guys working on that? If you want to share with us, to all 3 of you, if you have some ideas or thoughts behind that. Ruth, we'll start with you. What do you think? ¿Cómo lo piensas? Are any other challenges with everything else surrounding us, the public charge? How do you continue to embrace trust in the community to let people know that this is still a safe place to come? This is a place that you can come and receive services.
One of the things I tell my clients is, like, you are in this country, you have a legal status, you are doing everything under the law. There is no way that you cannot have access to health insurance. And I try the work as navigator is not only talking about health. Sometimes we have to start from the very beginning and start digging, why are you afraid? What is this? So we have to start teaching them how to have access, why they have the right to have the access to insurance, and like, we want to talk about public charge, because that is a big problem that we find, that they, especially in the mixed families, that when they have different legal statuses, they are so scared. And then we start teaching them, like, you qualify, you might qualify for this, you might qualify, and like I said, we have to have the resources in their language. That's the important thing. And so they really understand what is going on. I always tell them, you came to this country to have the American dream. And if you don't have health, you will have the American hell. Because you need to be healthy in order to be productive. So it's part, and we need to focus as to, like, sometimes we health is the less important thing, but I always tell, like, you need to prevent. Like, when you use a car, you pay insurance for your car, and you don't mind because it's gonna help you when you are praying, like, please God, I don't want to have an accident, but it's going to help you in the moment that you have an accident. So this is the same thing. You're healthy, you feel like nothing is going to happen, but you have to have prevention here. You need to be prepared if something happens, and then you can have the American dream in this country.
Good. Well, very well said. Ms. Casada, do you have anything else in terms of challenges that you see that are?
Yeah. I am not a professional working in the healthcare sphere, so I will defer to the experts on that. However, as a DACA recipient and as someone who has worked very closely with other DACA recipients, and also as a student of the law, and I do have some real-life frontlines work in immigration law specifically, I think that one of the problems that is most difficult to tackle because of its abstract nature, but is so incredibly important to address, is just the fostering of hope in our community. I see this a lot online. For many DACA recipients, our parents are also immigrants. Our parents made the decision to bring us to this country. For that, I will be forever grateful to mine, I just want to say. But I also think that many of us are beginning to recognize that our parents were very much concerned simply with surviving so that we had a shot at a better life. And what exactly does it mean to have a better life? Is it just having employment? Is it just making it day to day, surviving? I don't think so. And I think that that is what is most difficult, because it isn't something that you can teach. It has to be inspired. And what I'm specifically referring to is a willingness to fight for yourself. Having disappointed hope is a terrible pain. And I think DACA recipients specifically, we are accustomed to having our hopes dashed time and time again. But we should still fight. We should still make the effort because we are worth it. I think that we are deserving of feeling good in our day-to-day lives. We are deserving of having access to professionals, to preventative medical care, to resources that will enable us to thrive, rather than simply waiting until there is a medical emergency to seek intervention. I know it's scary. Every morning that I wake up and I think about this particular issue and all of the boxes I have to cross off, and all of the emails and the phone calls and the processes that I will inevitably have to engage in just to understand exactly how to do this, how to get my paws on this medical insurance. It is terrifying and it is stressful, but it is worth it because my parents have taught me that I am worth it. I'm worth fighting for. And if there's anything that I could communicate to my fellow DACA recipients, it's that they're worth fighting for too. And it starts with fighting for yourself.
Beautiful, thank you. Dr. Muntz, anything else you want to flag for the audience in terms of open enrollment or CMS updates that we should expect here in the near future?
Yeah, I will just say, you know, from the federal government perspective, like I have no designs, although sometimes we find ourselves in this trap, right? Which is, we put out a final rule, so there it goes. Everything will magically happen, and those folks that we wrote in the rule that we expect to hopefully extend coverage to over 100,000 previously uninsured DACA recipients in the first couple of years. We just, I have no designs that magically happens, right? And this is particularly hard because of the issue that we're talking about here, which is trust, right? I'm from the government. I'm here to help. We really need to, and what we have been focused on here at CMS is how do we provide the materials and the trust and the very specific knowledge, the kind of technical knowledge, to the right partners, to our partners, to ensure that these very technical rules that we write actually have an impact, our intended policy impact in the community. And I think kind of specifically, what I just heard is validation of that. I don't think that I personally am going to have success. I know that our partners need to have success in connecting folks to coverage, and this is particularly hard for DACA recipients because of the hope that you just talked about. We are over this upcoming open enrollment November 1st. We're over 10 years since the Affordable Care Act. Since the marketplaces came online in 2014. And each of those 10 years, DACA recipients have not been eligible. And it's a difficult message to say, hey, I know before you may have tried and your hopes were dashed because you weren't eligible, but now you are. That's an even more difficult kind of sell to say, hey, no, come on back, the laws have changed. And so we're focused on equipping our partners with that knowledge with that capability of saying, here's exactly how it's changed, here's why it will be different this time. And the second piece is that component that is, if you see one success, if you see the success of a neighbor, you're much, or community member or a friend, you're much more likely to say, hey, I can do that myself. We put out a report, the administration put out a report just recently that said that 1 in 7 Americans since 2024 have had marketplace coverage, have benefited from this Affordable Care Act marketplace coverage, specifically marketplace, not just Medicaid. Medicaid is a whole other, much more, many more millions of Americans there, but 1 in 7. And so it's that that knowledge of, hey, a member of my community has had success in that coverage, I can too. And so our job is to connect folks to those success stories, to connect folks to the community members, the partners out in the community that we've equipped them with the knowledge. And so that is what we are specifically working on. We've got a lot of toolkits, et cetera, to come. Please contact us. And we will probably contact you because we have an incredible open enrollment campaign coming up starting in November 1. I would encourage you all to, and we'll reach out with specifics, but specifically in November we do weeks of action during our open enrollment campaigns, and we have a Hispanic Week of Action in the month of November, still narrowing down those dates. But we really hope to have a very large push here for our Hispanic population writ large, but also specifically with the rules have changed, the focus on our DACA recipient population.
What I hear from you, Dr. Muntz, and I've heard from Secretary Becerra many times, the thoughtfulness and understanding of that we need to do and continue to do more and more outreach, provide more tools. And believe me, and I think a lot of us in this audience understand the challenges, always the challenges, and the tediousness, and also just the upfront trust of getting people to get covered. And they're not dependent on the ER as their coverage, right? And for people to understand that insurance and having access and coverage isn't only beneficial when you're sick and you're not feeling well, but that preventative piece. And hopefully, God willing, it catches people on the early onsets of something that can be very tragic in terms of just getting tested and for various different issues. And so with some of those things, again, go back to you, Ms. Solana, is the navigation, the outreach, the trust is what we're hearing up here, the trust, the constant trust building. Anything you can share with the audience in terms of some tools that they can take back with them and just learn knowledge over all these years?
First of all, try to get trained, educated about the changes. We need to really understand the changes in the law and everything. I always, when I am not sure about the answer, I will always tell my client, let me call you back, because I don't want to say you don't qualify when you really qualify. If I am not sure, please call somebody, ask somebody, make sure that the answer that you are providing to the client is the correct one. You don't know how many clients have come to me and say, but I was told I didn't qualify. And I was like, sometimes I think, oh, this was before this law changed. No, it was just saying no, and this is the moment. No, you all the time you qualify. I remember a mom coming to me, and she has 5 children. And she was told she didn't qualify. And she actually was told by the lawyer that it was a public charge to be in the ACA. And for so many years, she didn't have health insurance, and the daughters were having a health condition. When I told her, no, you qualify, and I helped her to do the application, she was crying. And I said, Ruth, you know how much money I spend in hospitals? This is very important for us to get educated, for us to be in the community, for us to be not only the health navigator that is helping to submit the application. No, we have to be more than that. We have to be there for them when we make sure that they are correctly approved, when they come back to us because they don't know how to use the insurance. They don't even know, I just received a card, now what I do. And we have to be step by step. Just think that there are little babies that are coming to this country. They don't know the system, and we need to help them to walk through. Eventually, you're going to start teaching them how to do it on their own, you know, and they're going to learn. We have to be patient. We have to have empathy for them. It's not like, oh, he's calling me again. I already explained. This is really hard, you know. Sometimes even for myself, sometimes it's hard for me to navigate just for myself. And sometimes I think, oh my God, how my clients are doing this. We need to think that they are little children, and we are working them, and we are educating them because they need the health. Health is a human right. It's regardless your race, regardless where you're coming from, regardless your social status, it doesn't matter. You are a human, and we need to have health. You know, when I go and I need to advocate for my clients, sometimes we are an immigrant and I don't belong to this country. No, I say I'm human and they are human, so I'm here to help another human to have access to health. We need to do that.
So the answer is we're going to bottle up a little bit of Ruth, and we'll all take her all over and do some training. That's how we're going to make it happen. Coming to the closing of our discussion here, anything that any one of you would like to share with the audience in terms of just general closing remarks, so hopefully things that brought you here, things that they can take away from.
I will just start by saying that, you know, here at HHS, our goal from the beginning of this administration, and we will not rest, is until we get everyone who is eligible enrolled in the marketplace. And we do everything we can, but those that last mile, that last couple yards, you know, whatever it may be, as we grow each year, really relies on the partnerships that we have together in making that happen. And so that's both a call to action and also a thank you. I really look forward to this open enrollment starting November 1, to building on all of that, and continuing to get to that every last person. So thank you for your partnership.
Yeah.
I think if there's one last thing that I could say to this community, and more specifically to the DACA recipients in this community, whether you are Hispanic or not, one of the things that I learned from a very important mentor of mine, a fellow immigrant woman who trained me when I was working as a paralegal in immigration litigation, I would often run to her desk completely panicked because I was sure that the entire world was falling in around me. And she would very calmly tell me to get myself together, and then she would say, Dania, there isn't a single problem that doesn't have a solution. And I find myself repeating that to myself multiple times a day. And I know it's easier said than done. It is much easier to say than to fully metabolize that statement. But the reason I bring it up is to emphasize the fact that we are not alone. The world is full of advocates. Some of them are silent, some of them are working behind the scenes, but we are not alone. And with enough partnership, with enough community, with enough hope, there isn't a single problem that doesn't have a solution.
Thank you. Thank you.
Very short, we are there to help a community. We are there to make the difference. Remember, we are talking about health. We are there to make the difference in some person between death and life. Mm-hmm. So be prepared for what you're doing. Learn, 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 so you can provide the right answer to the client.
Thank you, Ruth. Thank you. Yeah, let me ask a question of the audience, and this is something that, in my experiences, has been something I've always learned and taken away. Right when I thought that I've done something pretty novel, amazing in terms of outreach, I walk away hearing something new. Is there something that you guys out in the audience can share with us, or share with the panel, something that you've done innovative in terms of the outreach to get out for that final role, the academic opportunities to reach your community? Can anybody share anything with us? No, don't be shy. Don't be shy. Yeah, yeah. Or questions for the panel.
Thank you. I work at the NIH with Dr. William Gall, and we work with rare genetic diseases on the undiagnosed disease program. That is part of the NHGRI. Yeah, well, I think I don't want to assume anything, but it is pretty hard to navigate the health system, and it's not a critic, or perhaps.
You're absolutely right.
It's pretty hard, even though you know and you have access. Translation of the things is not the way. I think is simplifying, not oversimplifying it, but simplifying it will be better. Mm-hmm. Like I was trying to understand what a community health alliance is, and I didn't see. And then at the bottom, that's
my apologies.
Yeah, no, it's fine. But you know, like it sometimes is hard. Like, and then the second thing is, I would say, so if for the undiagnosed disease program, people from the states who can receive access to this, if they apply and they receive granted for coming to the NIH and then receive these tests just to receive a diagnosis, it is pretty hard. Let alone, or let's imagine the people that are not accessing to these health insurances. So it's pretty hard just to navigate everything. So is there a way in which HHS or probably Dr. Ellen Muntz, you have considered like oversimplifying the insurances barriers that they have, and have you talked with them like directly saying like, hey, you know, guys, this is very complicated, like waiting for you 3 months to receive an approval just to go and then receive tests is kind of hard. And when they are like recipients of immigrant people, it's pretty hard, isn't it? And then waiting a long time. So
yeah, thank you. Dr. Muntz, can you?
Sure. Let me I'll say a few things there, and thank you no one denies, and I think it would be a mistake for us to assume, and we work very hard to make this a reality, that coverage and getting health insurance also means that you get health care, right? And there's often that gap, right? I'm covered, but I'm having trouble accessing the actual care that comes with the coverage, right? There's the financial security of health insurance, but it should also provide health, right? And that is health care. It should provide the prevention. It shouldn't just be there in the case of an accident. And so we've worked to do a few things to help ensure that when folks get coverage through the marketplaces, through the Affordable Care Act, that actually means that they get not only insurance coverage, that they get health care that comes with it. First, we've done a lot of work to help ensure that all the health plans that are offered on the marketplace have adequate networks of providers. And we've done specific work in the behavioral health space in the last couple of years to ensure that we know and we acknowledge, right, health, mental and behavioral health care is health care. This is the same thing. There should not be disparate access to medical care, versus surgical care versus mental and behavioral health care. So we've done a lot of work on network adequacy. Second, we've done some work to offer more kind of standardized plans on the marketplace, which ensure that that if you buy one of these standardized plan options, that you're going to get first dollar coverage, which simply means that you don't have to deal with a deductible. You're just doing a copay to go see kind of a primary care doctor, that you just have a copay to go get outpatient behavioral health care, that your prescription drugs you start off with just a copay, and you're not doing you don't have to deal with a deductible first. And so we've done a lot of kind of insurance design to ensure that it's not just a card that you get and you say, oh, good, I'll be good in an accident, that it is a card that means that you actually get care. So thank you for that comment. We have a lot more work to do. Insurance is complicated, and unfortunately that's kind of, we do rely on folks to help navigate the complicated insurance system.
Thank you, Dr. Munson. I think it's fair to say just across the nation, every state's a little different. And I think it's also important to continue advocating and working with those that provide the health care. I know it's something we struggle with in Nevada quite a bit in terms of just being at the bottom of a lot of different lists in terms of the droughts and deserts of providers. And so it's definitely a balance in a complicated relationship. Yes, ma'am. Oh, I'm sorry. You have I didn't see the microphone in your hand. There you go.
I'll be fast.
Yes, please.
Hi. Thank you so much to the panel. My name is Dan McSwain. We raised money earlier this year to launch a youth mental health startup que se llama Mente. We launched in Maricopa County in Arizona as our pilot market, and we deliver. Oscar, I'm taking you up on your offer to ask if something is truly novel.
Yes,
because
please.
We want to connect with other people doing this work. We deliver positive, medically accurate, and culturally relevant mental health content on social media, and we do culturally driven pop-ups to decrease loneliness, increase a sense of belonging, and drive connection among young, diverse communities in Maricopa County. And as an offer to anyone in the room, we would love to partner with you in any way. Dania, I was listening to your story and thinking about how honored we would be to feature your story and your experience of navigating everything that you've had to navigate on your mental health journey, because stories like yours inspire other people and give them hope. Mm-hmm. And so, in my wildest dreams, we're in the hope business, and if you want to join me in that, we'd love to talk to you.
Awesome. Thank you for sharing that. Thank you. Do we have time for another one or two questions? Yes. Thank you for sharing.
Hi, thank you to the panel. My name is Laura. I work in the managed care organization space. And Dr. Muntz, this question might be best answered by you, but I'm wondering, I work primarily with bilingual clients, and I'm wondering if there has been any work being done or what is being done regarding renewal processes for Medicaid. We're seeing long processing times for redeterminations, and oftentimes it's causing a delay in care. Things like, lack of access to their prescriptions or being able to go to their outpatient appointments for that preventative care. So I'm wondering if there's anything being done in that space. And I also wonder how will the office manage, both of those priorities, bringing in this new policy, as well as making sure that the programs that are currently in place continue working.
Thank you for that question, and I know we're almost out of time, so I'll keep it short and offer to connect with you. As folks in this room know, ever since Medicaid redetermination started over a year ago, Medicaid agencies, since for the first time before the pandemic, since the pandemic started, have been doing redeterminations, and we have seen the kind of wait times for determinations in states be longer than we would like. And so my colleagues at our Center for Medicaid and CHIP Services have been working really intensely with states that kind of fall out of the boundaries of what is allowable for kind of these redetermination times, have been really doing intensive work with these states to change their systems, to make sure that they have the appropriate staffing, to get them back into compliance. And a lot of work has gone on, and a lot more work to come. While folks are getting redetermined, they should not lose eligibility during that redetermination process. And so want to connect to make sure that isn't happening, and you're not seeing that happen. And then on the how do you make sure that, while you're doing new things, you're still focusing on, the foundational work at hand? And I will say, thank goodness, we can do both. And we have just incredibly, talented, dedicated public servants that work for us, that work on this, that say, give me more, we can do more. And also, I would just say we rely a lot on our partnership to get out the word. We have our extenders, and many of our extenders are here in this room today.
And with that, we'll close up the session. I just want to thank everybody for being here again, and thank you to HHS and Secretary Becerra. I think these are important conversations to have. It's the second annual one. Hopefully I'll see all you guys' beautiful faces next year at our third one. Have a good day. Take care, you guys. Thank you.
All right, wow. What about another round of applause for our amazing panel? Thank you. I want to reiterate, I think, 2 points that Dr. Muntz and Dahlia and Ruth actually made. And one is that Dr. Muntz mentioned how since the day one of this administration, from President Biden, Vice President Harris, and Secretary Becerra, they've been fighting for the DACA community in particular, our young people. Not so young anymore, but certainly that population is always top of mind, front of mind for our leadership. And so huge deal, please. Oh, and then of course Dahlia, with the reference of with hope and when there's will, there's nothing that we can't do together. So that really appreciated her touching on that. And keep the questions coming. Those were great. If you didn't get a chance to, to ask your question, find one of us. We have several staff around. We're happy to give you our business cards. I'm at eduardo.cisneros.hhs.gov. It's not hard. It's my name and last name. Happy to help any way we can, and ask that you help us get the word out. Again, November 1st, a huge day for us. So thanks again, and what an amazing panel. Next, it is my personal privilege, actually, to introduce our keynote speaker for today. She is a fierce advocate for our community. She is a personal friend, a professional friend, an amazing ally to the administration, to President, Vice President, and the Secretary. Congresswoman Nanette Barragan is also the chairwoman for the Congressional Hispanic Caucus currently. She, first elected in 2016, represents the Harbor Gateway area of the 44th Congressional District in California. That's the kind of southern part of Los Angeles County. She comes from humble beginnings that have shaped her interest in matters locally, the environment, health justice, immigrant reform, strengthening the economy, and ensuring affordable and accessible education. The youngest of 11 children raised by immigrant parents from Mexico, Congresswoman Barragan knows the challenges that many of our low-income communities face firsthand. Her father, a local TV repairman, instilled in her strong work ethic and also influenced, very importantly, influenced her love for baseball. And this is why she and I get along so well. A huge fan of the Dodgers, Los Angeles Dodgers. Yeah. And her mother only had completed up to the third grade education, cleaned home, cared for others, and worked in factories to make ends meet. But both her parents, Congresswoman Barragan's parents, instilled in her from very early on the values of hard work that allowed her to obtain her undergraduate degree from UCLA and her Julius Doctorate from USC Law. So it is my pleasure to bring up our keynote speaker for today, Congresswoman Barragan.
Well, good morning. It's great to be here with you today and have the opportunity to speak at your annual Hispanic Health Summit for a second year in a row. He mentioned I was a big Dodger fan. Last Friday night I got to throw out the first pitch, so I was very excited about that. That was my highlight last week, and of course the CHCI Gala. Hopefully you all had an opportunity to come out. I want to thank the Department of Health and Human Services for organizing this summit. I also want to thank all the speakers and all the advocates and other leaders here today for your important work and everything that you do to help improve Latino health. This event is special for me as a representative who has a majority Latino African American district. So you're talking about 80% of people of color, 80% of people who are in underserved communities, who are low income, who really need the help of HHS and policymakers to fight for them, to make sure that they have access to care. And that's something that we also do as in the Congressional Hispanic Caucus. It's about fighting for the values and the policies that are going to make lives better for those in our community across the country. And so, as we know, last week marked the start of Hispanic Heritage Month, a time when we celebrate Hispanic culture and embrace the unique backgrounds and perspectives of our community. So there's no better time than to talk about health and, of course, Latino health. I want to also thank Secretary Xavier Becerra and the entire Biden-Harris administration for their continued commitment to increase access to affordable, high-quality health care, especially for people of color, Latinos, and those who for too long have faced barriers to care. Now, earlier this year, the administration finalized a rule to allow DACA recipients, also known as Dreamers, access to the Affordable Care Act marketplace. And that's huge. It's making sure that we continue to do all we can so everybody gets access to care, regardless of your immigration status. Now, once in effect, this will help tens of thousands of Dreamers access more affordable health care. And last month, I was proud to join President Biden and Vice President Kamala Harris as they announced new measures to help Americans save money on prescription drugs. If you weren't at that event, Xavier Becerra was there too. It was really a great energy, great excitement, and people who have hope in the policies that are now being implemented of the work of the last several years. And thanks to the Inflation Reduction Act passed into law in Congress by Democrats and signed by the President, we've successfully negotiated to lower cost for 10 of the most expensive drugs in the Medicare program, and this will offer a significant relief to millions of Americans, especially low-income Latinos who often face tough financial decisions due to high drug costs. We've made strides, but there's much more work ahead. And I can tell you that in my congressional district, when I talk about this, people say, when is this going to go into effect? I don't feel it yet. It's coming, and we have to keep reminding them that it's coming, and they will get that opportunity to feel it. Now, in my role as chair of the Congressional Hispanic Caucus, I have worked to ensure that the caucus has taken an active role to protect access to health care coverage and improve health outcomes for Latino communities. We've also been doing something called CHC on the Road. It's where we're going across the country, we're engaging our communities where they are to talk about legislation, bills, efforts that are being made. Last year, the CHC was joined by Vice President Harris in Houston, Texas, to discuss how Latino communities are impacted by critical issues such as reproductive rights and mental health. We were also on the road with Xavier Becerra to talk about mental health, which we know has a lot of work that we need to do in this space to make sure everybody has fair access. And so it's events like this that allow CHC members to engage directly with stakeholders across the country to better understand the issues and foster legislative solutions. And I know this is not a political event, but it does make a difference on who's in power. Because in the House of Representatives, who's in power decides what the agenda is, what the bills are, what the hearings are, and that makes all the difference in the world when you're a member of Congress and when you're trying to legislate and improve lives, because it's about the values on who we're fighting for. Now, we also partner with the Congressional Black Caucus and the Congressional Asian Pacific American Caucus to address the issues that impact communities of color broadly. This is something that I have taken a lot of pride in as chair of the Hispanic Caucus. Most recently, the Tri-Caucus reintroduced the Health Equity and Accountability Act. Now, this is a comprehensive legislative package that builds on the Affordable Care Act to address ethnic and racial health disparities and improve health outcomes for people of color. It includes policies to expand health care insurance coverage, to improve outreach and education in underserved communities, and increases things like diversity in clinical trials. Now, the Tri-Caucus has alternated. Every Congress, the CHC will introduce it, or the CBC will introduce it, or the KPAC will introduce it. It's really about our commitment to make sure we're continuing to fight to get it across the finish line. And we know that there is strength in numbers, and that we have to work together to uplift all our communities. And if you take a look at just the numbers and you were to do the math, and you add up the members of the CHC, which is the largest in history ever at 42 members strong, and you added up the CBC members, and you added up the KPAC members, we would be the majority. And that is strength and power and in numbers that we need to continue to use and foster and work together on. Additionally, I've worked in my own personal office on legislative initiatives to address health disparity for Latinos. Nearly half of Americans suffer from at least one chronic disease, and Latinos face higher rates of certain conditions such as we know, diabetes, hypertension, and obesity. And these disparities are often the result of social determinants of health, including limited access to nutritious food or safe housing and opportunities for physical activity. That's why I've introduced a bill called the Improving Social Determinants of Health Act. This bill would authorize the Centers for Disease Control and Prevention to award grants to build organizations' capacity to address social determinants of health. And another factor we often don't hear about when we talk about health is oral health. Now, as a kid growing up in a Latino household, we always had Coca-Cola. It was always on the table. As a matter of fact, when I think about it, we had more Coca-Cola than I remember water sitting on the table. And I didn't know any better, and I have to think my parents didn't know any better. But when I was a kid, I had these like decaying teeth, and I never knew why, and I didn't understand why. Of course, now, knowing what I know about the connection. This is no beef against Coca-Cola, but it really is about the sugary drinks, right, that sometimes we have in our communities, in our households, Maybe our parents didn't know better. But it's also about access to oral health. And so access to oral health is a preventive care and treatment, and it remains limited still for too many. 68.5 million adults do not have dental insurance, and Hispanic individuals are twice as likely to have lost dental insurance in the last year than white non-Hispanic individuals. That's why I've introduced a few bills like the Medicaid Dental Benefit Act and the Medicare Dental Benefit Act. And of course, for kids, the Ensuring Kids Have Access to Medically Necessary Dental Care Act. These bills would ensure coverage of routine dental and oral health services in Medicaid and Medicare and the Children's Health Insurance Program, respectively. And again, as that kid who had those issues, it's something very personal. And oftentimes, as a lawmaker, it is our personal experiences at home that lead us to be advocates, that lead us to be at the forefront of maybe going against your own party because for whatever reason, political or not, it hasn't become bipartisan. Now, my mom is 83 years old and she has Alzheimer's. And it's been a real challenge. It's been a real challenge to be a caregiver when you have to be in Washington and fly across different time zones. And so whenever I hear about advancements in Alzheimer's, I'm always talking to everybody, Democrats and Republicans, because I say healthcare is not a Republican issue, it's not a Democratic issue, it's an issue for all Americans. And how can we get together? Thank you. And how can we get together? How can we work together to make sure that we're all rowing in the same direction? You know, you see on television, of course, the partisan politics, because that's what they focus on. But there are conversations happening behind the scenes. And those conversations are, how can we make sure that we get our leadership to agree to get a vote on this or move this forward? And so I will continue to do that. I will continue to work with anybody who is making sure that we're having that equal access to care, to treatments. It shouldn't just be about who can afford it, but it should be about making sure that everybody, regardless of income, has access. And finally, I want to highlight how language and cultural barriers also play a significant role in health disparities for Latinos. Many Latino patients face situations where language becomes a barrier to receiving accurate diagnosis, understanding treatment options, and adhering to medical recommendations. So we must ensure our healthcare providers not only understand, but respect the cultural values, traditions, and the unique needs of our communities. And I think one way to accomplish this is to increase diversity in the healthcare workforce. Now, I can tell you, when my mom, who speaks English, but now because of her Alzheimer's has kind of reverted to Spanish, when she goes to see a medical professional, if they look like her or they speak Spanish, it's remarkable to see the difference in the trust and the ability to communicate with them. And she's much more smiley and happy and willing to follow directions, which could be a real challenge when you have an Alzheimer's patient and you have somebody who's older with dementia. And so one of the things that I have been doing is when Congress reinstituted community-funded projects, or some people like to call them earmarks, it was making sure that we were giving grants to local schools so that they could expand their access to provide education in places like Southgate, California, where the majority is Latino, where we want to educate and train those in our community to work in our community and to work in those neighborhoods where they live and where they come from. And so we'll continue to do that and look for every opportunity to work with HHS and any other stakeholder to make sure we are not just filling the shortage of the jobs in the healthcare workforce, but also making sure that we have culturally competent folks that are looking like America. And if you don't know, every 22 seconds, a new Latino is eligible to vote. That's pretty remarkable statistic. And so despite making up only 19% of the U.S. population but growing, only 9% of the nation's healthcare professionals are Latino. And that's why I'm proud to lead the appropriations letter to increase funding for the Federal Minority Fellowship Program at the Substance Abuse and Mental Health Services Administration. The Minority Fellowship Program aims to address health disparities and increase diversity in the behavioral health workforce by providing grants to trained professionals in key fields like nursing, psychiatry, and social work. And so it's through initiatives like these that I will continue to fight so that every American receives affordable and high-quality care. Now, I would be remiss if I closed out without mentioning another big issue across the country, across our community, and that is women's reproductive rights. It's fascinating when I travel the country and I'm on the ground sometimes, and I hear young people say in California, say, well, that's not going to impact me because we're in California. And in California, we have every right to have access to women's reproductive rights. And I have to remind them that if there's a federal law, if there is a federal ban, that those rights and those privileges are going to go away. And I think this is why it's important that we engage with our young people and we engage with those in our community to let them know what is on the line. Now, there are many women, especially Latina women, in places like Texas and other places where they don't have those rights right now. And they're having to travel. We're hearing, of course, the stories of women that are dying unnecessarily. And so there is a lot at stake. And the work that you all do and the work that we all do collectively as a coalition couldn't have a bigger impact as it is today. Knowing that this is all on the line and women's health is on the line. And of course, you hear the stories of women who are going through pregnancy who can't even get the care that they need for the pregnancy because doctors are afraid to treat them. And that is a real issue. Now, in Nevada, where I've spent quite a bit of time recently, we know that 81% of Latinos believe women should have access and the ability to make their own healthcare decisions. And I continue to believe that. And I will make sure we're continuing to fight to protect women's reproductive rights. So as you go about your day and you go about these very crucial days, I just want to thank you all for your work, your continued partnership, and your coalition building that we can, because I know that when we work together, we can honor our heritage, our Hispanic heritage, and by sharing that we all can live long and healthy and prosperous lives, but that we also have those choices and those abilities to have the access to care, first of all, and then to make those decisions. So thank you again for this opportunity, for your time to speak to you, and know that I am a partner. If I can be helpful as somebody who sits on the healthcare subcommittee in Energy and Commerce, the intersection of healthcare and the environment is among my top priority issues. And that just stems from the fact that I represent a district that's in a very heavily polluted area of the country, where when I was running for Congress, just to give you an example, I wanted to I wanted to take a photo in front of all the oil drilling stacks to talk about air pollution and what it does to health. And in that moment that I was sitting in the street to take the photo, I had a security officer come out from the local security company that provides security for the oil drilling facility. And they were trying to tell me I couldn't be in a public street. And I remember, I'm a lawyer, I'm a trained lawyer, and I was intimidated. And I thought to myself, if I'm undocumented or I'm a citizen and I don't have training as a lawyer and somebody comes up to me and is intimidating me and telling me that, you know, they're going to call the police or I can go to jail, I probably am going to stop. And it reminds me of when I was a kid and my mom used to say, "Oh, mija, no, we don't protest, we don't raise our voices. We're just lucky they let us be here." And I was always the one saying, "No, Mom, we have rights. We got to fight for our rights." And that is what we have to do. We have to continue to fight for our rights. So thank you all so very much. Muchísimas gracias.
All right. Thank you so much, Congresswoman Barragan. Next, we have another great conversation discussion for you all. And actually, as I was listening to the Congresswoman speak and earlier today, the Secretary speak, this next topic is on a really key issue for us. And it's about caregiving. And so many of our community members, our leaders even, are caregivers for members of their own families, right? So Secretary Becerra cared for his father in the last years of his life. And then as we're hearing now from the chairwoman, the Congresswoman Barragan also cares for her mother. So really personal issue to many folks, but also you hear about it more and more, particularly in our space, in our Latino households. And so really excited to bring up this next fireside chat conversation. Colleague Lily Griego, who represents the Secretary out in the Denver area. She covers the mountain region for us at the department. She's our Regional 8 Director. Her and Sandra, come on up, please. And I'll just say this is going to be a really great conversation focused on the caregiving work that caregivers do and what we've been doing both as administration, Biden-Harris administration, as well as here at the department. One key thing that you'll hear Lily talk about, and that was alluded to, is how through CMS, through our powers at Medicaid, we've been able to increase wages for home care workers, which is a big undertaking that we were able to realize this year as well. So again, a really critical issue, and I'm really looking forward to this conversation. So I'll turn it over to Lily and Sandra.
Thank you. Good morning, everyone. Gracias a Eduardo, my jefe, my boss. I have multiple bosses, and the one that I tell everyone about is Secretary Xavier Becerra, the first Latino in the history of this country to be the Secretary of HHS. I know you've heard that already today, but can we get another applause for that? So it's my honor to be here with you all today, and I'm so grateful for the time that you've taken from your schedules to join us today for this important conversation. We're going to be very focused on hearing from Sandra Diaz, who's joined us today from New York. I had an opportunity to learn about her a little bit last week, and our time with you is short, so we're going to dive right in. Eduardo just captured some of the information that the Biden-Harris administration has been steadfastly focused on. Number one, calling out and recognizing the pay issue as it relates to caregiving and home care. And number two, hearing directly from those who are providing the care. What are the barriers to their success? And that's why we come to you today with Sandra Diaz. I'm going to just welcome Sandra to the, I was going to say to the stage, to this fireside chat, and ask Sandra to introduce herself.
Thank you. Good morning, everybody. It's a privilege to be here at the Hispanic Health Summit. My name is Sandra Diaz. I was born and raised in the Bronx, Puerto Rican heritage. So if you know what New York says, we're New York Rican. And I was born in the Boogie Down Bronx, if you want to get real. So I could, my block could know I'm representing. I'm a mother of two. I'm a delegate. I'm a member political organizer and a passionate healthcare activist with 1199 SEIU. I was a home care worker, health aide for 14 years. I got my certificate in 2011. Through the educational fund, I became a CNA. I did an apprenticeship at my nursing home that I work at now, Westchester Cabrini Nursing Home. So now I'm a certified nurse's aide. It's going to be on 2 years. So, so that I am from the Bronx. I'm Puerto Rican, and I'm here.
That's awesome.
and I'm thankful that God gave me this platform to speak for the unspoken, because my coworkers are not here, my residents are not here, my patients are not here. So I'm glad that I'm here to speak for them and tell you guys what they tell me, that they're scared, they're tired, they're exhausted, and we need to make a difference.
Sandra has already begun to tell us the story, and she also shared with me, we're going to hear today about some of the barriers and challenges, but she also shared about the leadership components that she is gathering every single day from the work that she does and the conversations she endures with her patients and her community, and also with her union, SEIU, and she shared that that's being passed on to her son, and I think that those are really valuable life skills for each generation to take away. Sandra, you began to tell us a little bit, so please elaborate on your your perspective about the challenges facing home care workers.
So my perspective on the challenges of home care workers is the lack of pay. But now that we heard that they're going to put more funding and the pay is going to get, the wages are going to get higher, and thank God. So, and sometimes we're overworked, we're overlooked. Home health aides are mostly people of color, Black, brown, Latina, immigrants, Sapase, my Haitian brothers and sisters. We provide critical support for older adults, people with disabilities, enabling them to live independently in their communities. And yet we have been overlooked for many years, not being recognized for the work that we do. Home care is the bridge that allows seniors and disabled people to stay at their home.
Thank you. That was a really important answer, and I just want to call out that Sandra and I had a brief conversation about the Biden-Harris administration talking about this and really focusing in on the issues at hand and really calling out racial disparities, ethnic disparities that folks are experiencing across the country, and the burden of not just showing up for work every day and showing up for your families, but this burnout feeling that we've been talking about for quite some time, and then also the pay inequities. So this is really important that President has called on Congress to take action and that the administration itself has been leaning into this conversation. Sandra, thank you. Let's take a different look at this, and what will the Biden-Harris administration's actions on caregiving mean for you and your colleagues?
Well, I say, I'm going to say, I'm like, yes, yes, yes. Finally, home care is being recognized. You know how long we've been fighting for years, year after year, and then when you get disappointed, and then we back at the same board and we're doing the same thing all over again. But finally, to get spoken of by President Biden and Kamala Harris I'm so happy about that. Like, sometimes it makes me feel like crying, because you don't know, we've been rallying through the cold, through the rain, lobbying at lobbyists and speaking to everybody that we can speak to, and for them to even consider us and doing what they're doing for us is unprecedented. Like, I'm so happy. It's like, words can't even express how happy I am. And it's not the beginning. We're just going to keep going.
Yeah. You feel seen?
I feel seen. You know how it is to work in an invisible workforce for so many years, and to finally to be visible and recognized. Wow. I can't say anything else. We've done our job, and we're still going to be in your face. If it doesn't go how we go, we're going to be in your face. You're going to see the purple and gold. We're going to be loud as we can be. You're going to hear us, and I think we've been heard.
Yeah, can I get a feel from the room? How many? Yeah, exactly. Secretary said it this morning. He said, if you're from DC, you've had your coffee, but we're making sure that everybody is in tune and in step with the enthusiasm and the passion behind Sandra's words. As a daughter of a union member, I celebrate that you just told everyone you're tired. You're tired of the fight, but yet you're still in our faces, and that accountability matters. And so
everybody has to be held accountable.
Say it again.
Everybody has to be held accountable. We're tired, but we're never going to be tired of fighting. And everybody has to be accountable.
That's awesome. So let me share with you just a few bullet points of some of the actions that we have taken from the Biden-Harris administration. Caregiving executive order from April of 2023, and I'm not going to deep dive on any of these. I just want to share a couple with you. Nursing home minimum staffing across the country. Why does this matter to you? You want to make sure that if your loved ones are in a nursing home, that they are being cared for and taken care of and seen by the staff there. The other thing is the Medicaid access rule, which we've heard a little bit from the previous panel, and then higher wages for Head Start teachers. So caregiving is, as we know, from the earliest ages, but also from our most vulnerable ages. And so this is a lifespan issue. This impacts everyone, but we know that Latinos, I speak that my two aunties took care of my grandma until they couldn't anymore. And that was, first of all, a blessing that they could do that, but it was also hard when we went into the nursing home of what that looks like. Sandra, you take care of some of the most precious people in someone's lives. How does that feel?
They are my babies.
Oh, tell us more.
They're absolutely adorable. They're my babies. So being that I worked in both spectrum, I work home health aide, so I worked in people's homes, and now that I'm a certified nurse's aide, now I'm working at a nursing home. you see both sides. You see when the nursing, in the homes, they want to stay home. But if they're afraid to go to a nursing home, we should be prepared and receive them because this is their new home. This is where they're going to live. And we have to make them comfortable and make sure they get the quality care that they need. And with the funding, with the short-staffed that we're going through, we're not really giving that quality care. Like just Sunday, we were short-staffed and I had 11 residents to take care of in one morning. So you can imagine how exhausted I came home. But you still have to keep up that face and make them laugh, make them happy, and make sure they get to their breakfast, make sure they get to lunch. But the most important thing, that they're happy, their nourishment, and just to give them that dignity that just because they're in a nursing home, they're not lacking anything, because we're going to make them laugh and we're still going to be their family, whether they're in a nursing home or not.
That's amazing. Quick question for you. What are lessons or a lesson that you would like to leave the audience with today? And keep in mind, we're looking at some of the beautiful faces here in the audience today, but we have a lot of folks across the country watching this online. And this is an issue that is near and dear to everyone, both from your perspective as someone who's providing the care, but the family members who entrust their loved ones to you.
So I want to say first off, like, impossible, right? The impossible contains an opposite word in it. It says impossible. So never let people say you can't, because you can, and we will never stop the fight to have livable wages and the right to have quality care for us and for the people we take care of. I just want to reassure that the people who have family members in nursing home, make sure they're in good hands. You know, I dance with them, I listen to music with them, we laugh, if you hear a story from somebody who's 103 years old, that's history. Like, that's an integral part of, you never get that even in school, of the lessons that after the stuff that they've been through and they're teaching us. So we have to value our elderly, because they're not forgotten. They're always going to be with us, and until the end, I'm always going to be there with them. You want to come bring them to my home? I'm there. But I just want to reassure the family that have family members in nursing homes that there's a whole lot of us that are caring, compassionate, empathetic, and there's no lack of love for our residents that we take care of.
Amazing. Thank you, Sandra. I just want to wrap up and say that it's been an honor to serve the Biden-Harris administration under the leadership of Secretary Xavier Becerra, especially as a union daughter, and then hearing stories from SEIU, in particular from Sandra, why this matters, this conversation, this relationship, the sense of accountability, the sense of trust, to make sure that those who are leading this charge to take care of our vulnerable folks, our family members, are empowered to come to us and have these conversations, and that we're doing right by you. So thank you so much, Sandra.
Thank you so much.
Can we get a round of applause for Sandra?
Thank you. Thank you.
Thank you.
Thank
Good
you.
job.
All right, how about one more round of applause for our great fireside chat participants there. Thank you for all you do. Next, we have another great panel. This one is on an issue that has also been talked about throughout the day from Secretary Becerra, the Congresswoman, and other colleagues. And this is the environment, environmental justice, how certain barriers in our communities, social determinants of health, and other things impact our community's well-being. And so the next panel will be focusing on what we're doing both in terms of efforts inside of our administration, at the department, across the Biden-Harris administration, but also externally with other partners as well, again, to address challenges with environmental health issues, to address issues that we're seeing more and more frequently. That is related to extreme heat. And so as Secretary Becerra mentioned, it is a lot of our workers that are in the fields and outside regularly, whether it's agriculture or farm workers, construction workers, with these record-breaking extreme heat spikes. We're more and more cognizant of the fact that we need to be addressing environmental concerns that we're facing across the country. And so the next panel will be talking about issues like implementing the Justice 40 initiative, removing barriers to language access, which we know is still all too common, and we'll cover that as well. And then connecting to our health systems, again, as I was already mentioned, in terms of providing healthcare coverage, but also thinking about how do we allow our community, encourage our community, connect our community to the health systems and benefits that we're able to provide for them, particularly things related to, for instance, climate resiliency through the Inflation Reduction Act. So these are things that made it to that historic legislation, which we call the IRA, but it's the big inflation bill that the President and the Vice President passed that have a lot of great benefits for our communities, including addressing some of the extreme heat issues that we're facing, again, all too common. We're also going to, our panel will talk about how we're able to connect our community to tools like looking at the vulnerability and social determinants of health, indexes and other tools that we have here at HHS. So we have, again, another fantastic panel coming up next that is going to provide their perspective on this incredible work as it relates to caring for our community's environment and health. And with that, I'm going to introduce my colleague, Ana Mascareñas, who's counselor to Secretary Becerra, to introduce the panel. Ana.
Buenos dias. Sorry, we're going to adjust to our height right here. There we go. Thank you, Eduardo, for the introduction. You actually hit on a couple of the points, but I do want to take a few minutes as we welcome an amazing all-women panel on stage in a few minutes to share a little bit more. So my name is Ana Mascareñas, and I really do have the privilege of serving as a counselor to Secretary Xavier Becerra here. I grew up in the New Mexico high deserts. My mother is a farm worker across California, and her parents and grandparents moving across the Southwest and California as well. She became the first in our family to graduate from college. She spent 40 years as a high school counselor, proud daughter of public school educators. And similar to how my colega B. Guerrero and her amazing team here opened up the day, I really do seek to honor my family roots every day that I have the privilege to be in this role. We understand how important it is from the lessons growing up about how we center our actions in service of communities always. So we know that at HHS, this is coming through our healthcare services, through everything we do, we seek to center health equity. And health equity is really linked to environmental justice. If you look at health disparities, it's really hard to find a health disparity that doesn't have some link to a factor in our environment. And that's what drove me to continue working in this field and now as part of HHS. So our vision here is a nation that equitably promotes healthy, sustainable, and resilient environments and protects the health, well-being, and dignity of all people and communities in which they live. And we know that those words reach across many issues that we all work on together. So the Biden-Harris administration has really made an unprecedented focus on environmental justice, and especially through the Investing in America agenda, the Inflation Reduction Act, never before seen investments in fighting climate change. We're going to hear about some of those partnerships inside and outside of government. And it's really about protecting La Madre Tierra, our Mother Earth, our people's health, our neighborhoods, and lifting everyone to these efforts. Whether it's asthma triggered by polluted air, exposure to lead or pesticides, we know these issues persist. And the new issues that climate crisis already exacerbates, flooding in addition to extreme heat, storms that we see increasing and more severe. So you'll hear more about the Biden-Harris administration's Justice 40 initiative, where at least 40% of investments are targeted to those communities that need it most, many Latino communities across our country, and many that have many aspects of identity and intersection. So through this initiative, I just want to highlight briefly that at HHS, we actually have 13 Justice 40 covered programs. From 2022 to 2027, we have over $6 billion to obligate to invest in communities around climate change, climate resilience, helping people heat and cool their homes, and also huge projects around water infrastructure in Indian country. So we brought an even sharper focus under Secretary Becerra's leadership over this administration by establishing 2 new offices, sister offices as I like to call them, the Office of Climate Change and Health Equity and the Office of Environmental Justice. And our teams here are guided in the Assistant Secretary for Health, Admiral Levine's office. So they've been catalyzing work across the agencies. Many of you know are familiar, but whether it's CDC or NIH or IHS, there's so many different agencies with different roles. And our job is to catalyze and bring momentum to the environmental justice and climate change work that we've all been doing together. I want to highlight an accomplishment. You'll hear later today from my amazing colleague as well, Director Fontes Rayner, who leads our Office of Civil Rights. And it's really worth noting that under this leadership, under this administration, Secretary Becerra's leadership, HHS completed the first environmental justice rights investigation and agreement. This was actually in Alabama and Lowndes County around local residents there, predominantly African-American community, not having access to basic sanitation services. And so creating a pathway for the right to clean water and sanitation. And there are still 2 million people in this country today, at least 2 million people, that don't have regular access to clean water and sanitation. Many of those communities along the U.S.-Mexico border, unincorporated areas that are underinvested in, and those issues persist. Our Office of Civil Rights, as you've heard a couple times, also has done huge steps to coordinate language access, break down language access barriers. I hope you'll all be joining us back here in October for our Language Access Summit. And such a critical first step to really being involved in improving our environments is understanding in a language and culturally competent way what is happening and how to get involved. So Secretary Becerra closes remarks this morning by talking about the initiative on protecting farm workers from extreme heat and wildfire smoke. And I'll speak for just a couple more points. We've invested in creating tools to help communities prepare for extreme heat and understand its impacts. What you'll hear from some of our panelists is a little around the Heat and Health Index. So looking at how extreme heat and social vulnerability overlap, and really creating ways that communities across the country can better prepare for heat resilience. That's one of the ways we've been doing this. The initiative looks across HHS, and recently the National Institute of Occupational Safety and Health developed a draft hazard review on wildfire exposure, smoke, and to farm workers and other outdoor workers. And just to put it in context for a minute, this administration early in the summer, for the first time, proposed a federal heat standard. So the first time, and we've had the science for a while, to propose a federal labor standard that will protect indoor and outdoor workers from extreme heat. We know the climate crisis is driving even more extreme temperatures. So that is proposed, and the science for those types of labor protections actually starts at HHS. So what we've done with this document around wildfire smoke exposure is start that conversation, put together the evidence, and we invite you all to also comment on it. It's open for public comment until November 12th. And it's really often the first step in creating protections today. It calls out a number of recommendations, but then sets a path for working across the administration and federal government for stronger labor protections for our communities. So I will turn it over and take a minute because it's really impressive and amazing that I get to be on this stage with my panelists here. As we continue to push for focus on our families and on the farm worker front in particular, I just really welcome all of you to join us in that. And I know many of you are already doing important work. So I will ask them to come on stage as I call out their names, please. First, we have Joan Cato. She's the Colaborativo 40 Campaign Director of Green Latinos. Welcome, Joan. Joan is known for her 2 decades of work in marginalized communities of color, grants management, and leading large-scale voter registration efforts. She has also excelled in government contracting, strategic communications, and change management. And as a consultant at Green Latinos, she initiated Colaborativo 40, promoting federal grant opportunities for major Latinx organizations. She's the founder of Everyday Voters, a firm specializing in community engagement and grant advisory services, and with a diverse career background, including Capitol Hill, candidate campaigns, and work as a Foreign Service Officer for the U.S. Department of State. Joan brings a wealth of expertise to the table. She is multilingual, speaking Spanish, Vietnamese, and Bahasa Indonesian. Welcome. Next, I'll bring on Adriana Hochberg. Adriana is the Principal Deputy Associate Administrator at EPA's Office of Policy, where she leads the newly established Office of Climate Adaptation and Sustainability. Adriana is passionate about building thriving communities, climate action, and good government, and she previously served in environmental management and leadership roles in local government, including as the Montgomery County, Maryland Climate Change Officer, Acting Director of the Montgomery County Department of Environmental Protection, and Montgomery County's Assistant Chief Administrative Officer and Chief of Staff at the Department of Energy and Environment. She has a Master's of Public Policy from Harvard University School of Government and a Bachelor's from Williams College, and is training for an Annapolis Naptown Half Marathon. And next, I would like to bring on Lily Griego, Region 8 Director. Lily joins the administration as Regional Director of the Department of Human Services, and her credentials include a stellar public service career that covered a wide range of local and federal policy issues, as well as a proven community engagement track record. Her valuable skill set is actually very active in the Build Back Better agenda. And she led multiple state teams during the 2020 census and all congressional affairs for the region, successfully earning additional congressional seats in Montana and Colorado. She worked as U.S. Senator on critical policy issues, including immigration, equality, and healthcare, and she has an extensive background in the public and private sector land use. Lily earned a bachelor's degree in political science and master's in history from the University of Colorado, Denver, and is a Colorado native. She believes wholeheartedly in good governance and serving the American people. Welcome, Lily. So I'm also very pleased to bring on stage Catalina Gonzalez from the Center for Progressive Reform. I am unfortunately missing the last page with your bio information, so I am going to ask when we introduce ourselves to please share a little bit about your background as well. We are really lucky that with this panel connected through Green Latinos, especially through Lily, through EPA, our colleague Juan Roberto Madrid, who could not make it this morning, connected us with Catalina and her work at the Center for Progressive Reform, where she is leading around climate resilience, connects work across California, state government as well, and is recently, actually not, I'll just let you introduce yourself when we start. Thank you. Okay, we're going to sit down. Sure. Thank you. So to start off, just to learn more about you and have some of the issues that you work on the table here, if everyone could please start off with just a little bit about how the environment and climate impacts the communities you serve. So a big question. And what are some of the ways your organization or your agency is addressing this issue? I'll start with you, Catalina.
Okay, sure. Good morning, everyone. Buenos dias. Thanks for joining us. Like you said, I'm Catalina Gonzalez. I work as a research and advocacy analyst at the Center for Progressive Reform. We're a national research and advocacy organization. We work with a network of legal scholars and also with partners and allies across the country in California, Maryland, Louisiana, North Carolina, and really where these a lot of these communities are frontline and fence line communities, and they're facing different impacts from refineries, dairies, and other concentrated animal feeding operations, highways. A lot of these folks, live near or adjacent to petroleum or petrochemical industry facilities as well. And really, it's, all of these communities are impacted differently, but there are common themes across all of these communities where there's legacy pollution, they're overburdened by cumulative impacts, and they're disinvested. And we see, time and time again across these states and these communities, they're predominantly Latino, they're indigenous, and specifically the health of children is negatively impacted. And so that's a little bit about, I guess, how we work. And I think another major theme is there's a lot of opportunities and there's a lot of innovation, and these communities are very familiar with the problems and they know the solutions that they need. So I'll leave it there.
Thank you. Is this working? Test, test. Yes, okay. Good morning once again, Lily Griego from HHS. What was not in my background shared here, and I thought about this coming to the panel this morning, is that I actually have 18 years of land use experience. From a funky perspective. So I did land use enforcement for 18 years. And learning from the lens of doing enforcement, you have to memorize, you have to be familiar with the laws that you're enforcing in order to educate the community on it. And what I often found in city government, and in Colorado, by the way, it's a municipal charter, so the city writes their own laws, and it's a home rule is what we call it. You learn that the laws are often written by those who are not familiar with the injustices and can speak like one of the panelists we saw this morning with her passion, with everything coming from the bottom of her belly and the bottom of her heart of saying, why is something unjust? And so that already paves the way for injustice in environmental protections and environmental justice. Then also working in county government as long as I did, the rules I often enforced, if you're ready for this, were written in the 1880s, 1890s, 1900s, 1910s. One of them that I enforced actually said that Latinos and African Americans could not live in the front house on the properties that I would often show up at. So let me just start by saying that I was beyond proud to get out of the truck and go knock on the door and be the one that was talking about these issues. But again, a funky perspective, right? Representing government and talking about these issues. Then working with Green Latinos and understanding a new perspective of advocacy, I felt really conflicted with a lot of the work I did. I just got the chills when I said that. I really felt the conflict of being a mom and earning a living wage through government. I worked for a job where I could be home in the evenings with my kiddo and live my life, but the laws were not representative of my core value system. And I often hear Secretary Becerra talk about our core values, and the Biden-Harris administration talking about racial inequities and racial injustice, and just really wanting to be in a space where I could do both. I could serve the American people, but I could also advocate for change and policy change. So with that said, what are the inequities that we face? There are many. And the more that your government leaders lean into the conversation of inequity, the more diverse the table is, the more voices are heard. And when we have leaders like Secretary Becerra and President Biden and Vice President Kamala Harris asking people to come to the table for solutions, we see that the road is long, but we also get to those solutions. And so that collaborative nature between government, between the private sector, between the advocacy sector, and like we heard from the previous panelist that she's going to be up in our face, Sandra said it, right? Those are the folks that are actually helping drive the policy changes that are needed to face the inequities of today.
Wow, very inspiring. Good morning, everyone. So great to be here. I get to serve every day at the Environmental Protection Agency, so I think it's fitting that I got the green mic this morning. And Anna, that is a quite big question that you asked. You know, at EPA, we are committed to protecting human health and the environment. That is our mission for all people across the country, including those historically marginalized, overburdened, and underserved. And as I was thinking about your question, you know, there are a number of different ways that I could go about answering it. I could point to the trends of environmental and health indicators from the last 50 years. EPA has something called the Report on the Environment that has dozens of indicators that track the state of the environment and human health over time. These indicators include exposure to contaminants, changes in life expectancy, prevalence of diseases, and many of these are trending in the right direction overall. But while significant progress has been made on many fronts, not all communities have benefited equally, as has been shared. There are continuing health disparities by race and ethnicity, and we know that pollution still happens far too often in underserved communities. And the impacts of climate change on health are worrisome. So I want to share a few stats here related to Latino communities and climate change. We know that Latino communities across the country suffer disproportionate environmental and economic burdens, and climate change only increases these risks. Our data shows that Hispanics and Latinos are 43% more likely to live in places with the highest rates of labor hours lost due to extreme temperatures. And they're nearly twice as likely to live in areas with increases in traffic delays due to coastal flooding. The impacts of climate change are especially relevant when you consider that the majority of Latinos in the US live in California, Texas, Florida, and Puerto Rico, These locations have already seen some of the most devastating effects of natural disasters that are made worse by climate change, including wildfires, hurricanes, and floods. And children feel the impacts of environmental pollution most acutely. Hispanic children are 30% more likely to visit an emergency room for asthma as white children. And according to a report that EPA released last year called Climate Change in Children's Health, new diagnoses of asthma are estimated to increase with climate change. The number of emergency department visits among kids are also expected to go up as summer temperatures rise, and additional premature deaths among newborns are also projected. There's an association between exposure to wildfire smoke and the risk of preterm birth. So that's why it's so critical that the US and the world continue to urgently advance climate solutions and reduce greenhouse gas emissions globally. And I can talk a little bit more about what EPA is doing on that front later on.
Thank you. My name's Joan Cato, and I'm our Colaborativo 40 director at Green Latinos. And so I've been working for this past year with the 7 largest Latino organizations in the U.S. to try to democratize the federal grant-making space. So for all these inequities that we're facing in our communities, everything from extreme heat to the environmental factors, the pollution, how it affects our health, asthma, cancer rates, et cetera, like to try to make sure that our communities get the dollars that are out there and the dollars that we deserve. There are currently $369 billion from the IRA and the bipartisan infrastructure bill that are supposed to be designated for our communities. They're termed low-income, historically disadvantaged communities, but we all can read through the lines and know what that means. And so I've been working with Green Latinos, and Green Latinos is an organization. We've been working to advocate for the Latino community on environmental justice issues. We've been also that place that Latinos can come and see other Latinos that look like them in the environmental space, because oftentimes we're working at like the EPA, and we might be the only brown face that you might see in a while. So we act as that convening space. And the third part of what we're doing right now is that we have a Justicia and Equidad Fund. And that's how we're sub-granting money that we're getting to frontline CBOs, frontline community-based organizations that are doing the work that we all know that needs to be done. And we also got the $25 million grant from the USDA to do tree planting and tree maintenance that also combats extreme heat. And we're going to talk about that, I think, in a little bit. But thank you.
Thank you all so much. We're going to stay on this topic of extreme heat and farm worker issues in particular for just a moment. So I'm going to turn to you, Adriana. There is a lot happening across the federal government, working in coordination, whole of government approach. I mentioned that Department of Labor proposed earlier the first federal heat standard. EPA also recently took action around pesticides, which disproportionately impact Latinos and farm workers. So could you speak a little bit about that emergency order stop use of Dacthal? I think it's important to kind of talk through that, and if you could share a bit more, please.
Sure, absolutely. EPA uses a multi-pronged approach to protect farm workers, including farm worker training on pesticide application, healthcare provider education on pesticide illnesses, rulemakings, and most recently, the emergency order to suspend the use of a pesticide called Dacthal. EPA took this action because unborn babies whose pregnant mothers are exposed to Dacthal can experience irreversible lifelong health problems. This includes low birth weight, impaired brain development, decreased IQ, and impaired motor skills later in life. After EPA issued this emergency order, the AMVAC Chemical Corporation, which is the only manufacturer of this pesticide, submitted a request to voluntarily cancel all of these products, which is great news. So AMVAC's decision to do this will ensure that pregnant women are no longer exposed to this chemical. EPA also has something called the Agricultural Worker Protection Standard, which aims to reduce pesticide poisonings and injuries among agricultural workers and pesticide handlers. Among other elements, this standard requires employers to provide annual pesticide safety training and decontamination supplies to agricultural workers and pesticide handlers. And we're also currently working to modernize something called the Application Exclusion Zone Rule, which requires agricultural employers to keep workers and all other individuals out of this area called the Application Exclusion Zone, which is an area surrounding pesticide application equipment.
Thank you, Adriana. And I know that anytime we're talking about the multiple issues farm workers and farmer communities face, the use of pesticides and concerns around toxicity is always there. And so appreciate that action coming out of EPA recently, and know that there are other pesticides that we continue to look at. I'll turn to you next, Joan. In talking about your collaborative work with the Green Latinos, especially the Latino Climate Justice Framework, are there any points that you would want to talk about, sort of how that framework would address farm worker health in particular?
Yes, so Green Latinos has been working with 150 community-based organizations to create the Latino Justice Climate Framework. And in that framework, we've talked about some standards that we'd hope to universalize across the board for farm workers that are suffering from extreme heat, such as making sure that there's mandatory breaks, making sure that there's water available for folks who are working in the field, to also make sure that folks that are doing this hard work get shade and have access to shade while they're doing this work. So I encourage everyone to check it out. It's at greenlatinos.org. The whole Latino Justice Climate Framework is very extensive, and it covers extreme heat, but also other issues that affect the Latino community.
Thank you, Joan. And turning to Lily, you cover Region 8, and we know that there's a growing Hispanic, Latina population. I have lots of family in your region as well. Can you share a bit about how overall sort of the region is growing to meet the needs of Latina communities?
Sure. So there are a multitude of things that come to mind. So Region 8, let me share that I have colleagues across the country. The United States Department of Health and Human Services has 10 regions across the country. Region 8 encapsulates Montana, Wyoming, Colorado, Utah, North Dakota, South Dakota, and 30 tribal nations. Why does that matter? Why do I describe that to you? What is the largest geographic barrier for that region? The Rocky Mountains. Where are the Latinos? Everywhere across that region. They're in North Dakota, they're in South Dakota, they're in every place I just mentioned. We know that we are everywhere and that we are not a monolith. We hear that all the time, and we share that all the time. We're trying to educate folks on who we are. But one of the things that stands out to me is how I heard from a state representative that the wildfires, and how many of you, by show of hands in the audience today here, and for those listening, I don't think you can see them, but we'll share this back. How many of you have paid attention to the wildfires in the Rocky Mountain West? Okay, so a significant number of audience members and panelists raised their hands to say that we're very familiar with this. This impacts the entire country, but think of those in that proximity to the wildfire. If they receive a 911 call, what language do we presume that that's coming in? That's coming in English. So immediately there's a safety factor for those who speak Spanish, assuming they have access to the internet, assuming they have access to a telephone. So one of the state representatives in Colorado said, wait a minute, well, she happens to be a wildland firefighter herself, and so ran for state office, Elizabeth Velasco, and then she comes to the table with her beautiful accent and says, by the way, we need this in Spanish. And that's not to mention a myriad of other languages that we need. So who would have thought of these little things except for the Latinos who live in these communities and are experiencing these on a daily basis? That's one issue. The other thing is, what happens to those who have jobs and homes there if they're displaced? It is a misnomer that recovery is quick and easy for the average person. And so we have to thank elected officials who prioritize equity, and the Biden-Harris administration has really called out equity at the top of our list. From day one, President Biden said, hey, all departments, I want to see an equity plan. Secretary Becerra said, by the way, all of my staff are going to know about our equity plan. We're going to publicize it. And we also just revamped it midway through the administration. In addition to that, we've highlighted the language access priorities. What I can also say is, as it relates to these issues that I'm kind of bullet pointing through this conversation, and we could deep dive on so many accomplishments of this administration, but I go back to the point that we are hearing from federal partners in the EPA And at the local level, we're developing those relationships in our regional offices. So let me take it right back to the regional office. And Ana said, tell us about what you're doing there. Each of the agencies inside of HHS that maybe you're not familiar with, so I'm going to throw out some federal acronyms: OASH, the Office of Assistant Secretary for Health; OCR, the Office for Civil Rights, within HHS, civil rights within Health and Human Services, but also our emergency preparedness brothers and sisters, and those who are doing all of this work. I saw a hand pump there in the audience. Those who are doing the work of research, CDC, NIH. We are looking at how do we level set when it comes to equity simultaneously while, and I'm going to kind of go back to this regional point, I'm seeing state legislatures work against equity and look at the word equity as a dirty word. And so our role is to really empower these conversations at a higher level from HHS and meet with our governors and our state legislators. And we see Republicans and Democrats come to the table and say, tell us why this matters. Tell us why this is important. And so I just really want to go back to what Secretary said, to say the diversity of his staff, me being there, having these conversations and hearing from Green Latinos, hearing from Conservation Colorado and Protegete, hearing from state representatives who live in the mountains of the Rocky Mountain West, who live in the rural communities that have a population of 200 to 2,500 to 5,000, or maybe even more, to say these are the issues we are dealing with on a daily basis. And that's why we travel and show up, and then we carry the message and we carry that water with you. Region 8 does celebrate that we have these partnerships. Unfortunately, the natural disasters continue to grow and really show that the need to react and be agile in our reaction is a must, and it's now. It's right now.
Thank you, Lily, for your leadership in Region 8 and across HHS, and being such an example and model for so many Latinas, especially here.
Awesome.
So, you know, on the topic of climate-related equity, so many of the efforts and needs across our nation that vary based on community and also what the landscape is of where people are and how our communities are growing. I want to turn to you, Catalina, for the Center for Progressive Reform. When we think of making equity in environment and climate in confluence with social justice, you know, we have a climate justice framework. We heard about Green Latinos Climate Justice Framework, but I know that especially in states in California, Center for Progressive Reform is very focused on climate justice. And a big conversation has been around how we move a clean energy economy with equity in mind, with justice in mind, and have a just transition. And economic justice, environmental justice, and social justice. So if you could share a little bit about your efforts around just transition, I think that would be really helpful for this audience to hear, and we'll dive in a bit more.
Yeah, so at the center, you know, we very much recognize that the reason we're focusing on climate justice is because that grew out of environmental justice, and environmental justice should really be the center of our climate justice work. And I share a lot of the concerns shared by the panelists of, like, our communities have existing health disparities, and, you know, they're only being made worse or, you know, compounded by, you know, these wildfires. There was people in California who were dealing with the COVID pandemic at the same time, where they had the worst air quality for weeks. So kind of like these impacts make conditions in our communities worse. I have a lot of worries when it comes to how we center equity in the just transition, but I just want to say that a lot of the federal agencies and the Biden administration deserve a lot of credit for the work they have done in basically revamping our government and creating hundreds of new programs to deliver benefits to our communities and implementing this government approach. So lots of credit goes to them. But I also want to say this is just the start, and the need in our communities is just really big. I think a very important point when we think about climate justice is to make sure that communities that have had these legacy pollution, are overburdened, continue to be basically sacrificed for a lot of the benefits and resources that we have. They need to benefit first and they need to be prioritized in this work. And I am concerned that, we're moving at a really fast pace, and, we have to get dollars out. We don't know what's going to happen with this election, but there is a risk that people communities are being left behind. And the biggest concern really I have is that, we, in this transformational moment where we have resources we've never had before, where agencies are working across sectors, that we're replicating, we're at risk of maybe replicating the same injustices that we've always had, and that, maybe we're not being transformational enough, or there's opportunities to do more. I think, so how do we do it? I think the work has started in designing programs that really have the right mechanisms, set the right requirements, set the right eligibility, and make the application process easier, so that we're targeting these resources, and we're targeting specifically capital to communities through set-asides, things like direct pay, eliminating things like first come, first serve models, which we know we always get there last, and we're not going to get the resources, or requirements that require matching funds. Folks from rural communities, small communities know it's hard to compete with a large city or a large metro area if you have to provide matching funds, and these programs have to be flexible. We found in California, a lot of the amazing programs that are available, they were not eligible to folks living in mobile homes. There's a lot of great resources to install solar, but folks need to make repairs, upgrades to their mobile homes, so that they're ineligible for these. So we really need to fix these and make sure that our state efforts and our federal efforts are aligning, and that it's easy for people to connect those resources. And also want to second Lily's points, is that states have a really big role to play here. They have a really big role in, they have to be accountable in how they're spending these federal dollars, and what agencies these programs are going towards, and who are those entities that are delivering these funds. In a lot of the cases, it's state agencies, local governments, public utility commissions, or utilities. So we really need to be really mindful and be engaged, continue to be engaged at the local level, so that these resources are delivered.
Thank you so much, Catalina, for your leadership, and Joan for connecting those pieces. Both of your organizations are really pushing to hold us in federal government accountable and understanding what's happening at the state and local community level to really meet those shared goals in those pieces. So thank you. We need you. Please keep pushing, and just really appreciate all the work you're doing. I know that Green Latinos was on the stage last year at our first annual summit, and we know one issue that comes up a lot in talking about environment and health and climate change is mental health and behavioral health. And it's increasingly so, especially in our youth, of all of these needs kind of coming together. So I was hoping you could share a bit, Joan, about what Green Latinos is doing in this space. There was a commitment ceremony last year. We have a great agreement to kind of share resources and information about how we could best prioritize mental health, behavioral health needs of the Latino community, especially in talking about environmental health and climate change. So if you could share some thoughts about what that connection is. We hear it all the time when our Office of Climate Change and Health Equity speaks with communities about how there's increasing need for support. We heard the Secretary earlier talking about 988, over 20,000 calls in Spanish, I think, just already with expanded language access. But in this very, very important space of envisioning the world we have today, and the hazards we're experiencing today, and also thinking about climate change in the future. Can you share a bit about how Green Latinos is thinking about that with your work in Latino communities?
So there's a whole bunch there. I'm going to try to unwrap a little bit of it. So last year we were here on the stage, we got recognized, and we committed to work on mental health and the conjunction between mental health and the green everything that's going on with climate change. And so we did get, like I mentioned, a $25 million grant from the USDA. We're re-granting $20 million of it. And we're trying to make it a little bit easier, but there's all these regulations. So I know exactly what you mean. Like, there's all these federal regulations to get these federal grant dollars. But if you go on our website, our application is, I think, only 8 pages long, which is incredible when you're talking about some of those NOFOs out there for federal grants that can be like 80, 100 pages. And we're trying to prioritize getting it to communities that need it the most. And we don't want to spend as much time, or we don't want you to spend as much time doing the application as you are implementing the work. And where this gets to be about mental health is that trees are such a big component to mental health. They're also a big component to improving extreme heat, right? Combating extreme heat. I got some cool stats about trees, and I don't usually read very many stats. I know my colleague right here has a lot of papers, but I don't usually do very many stats. But there are some cool stats out there that I do want to read. Okay, 1 day is the average time that is reduced in a hospital stay by having a window at your hospital, or window in your room, that is by a green leafy window. So you can reduce your hospital stays by 1 day compared to folks that don't have that green leafy room. Watching a 6-minute video of dense trees reduces your stress by 60%, right? Take some of this in, right? And then if you spend 2 days in nature, the white blood cell counts that fight cancer increase by 50%. So that's the connection between trees and improving our mental and physical health. It's not just mental, it's also the physical. When you're looking on the inside and you're seeing how it improves your physical well-being, your white blood cell count. I mean, when I first saw that, I was blown away. Like, how can it be possible? But that's where we need you all that are out there, that are looking at these grants, that are thinking about these opportunities to really start making some like creative investments, creative ideas. And we don't have a match on our grant, which is beautiful, because I do know that matches also make it very difficult for folks. It's on our website, greenlatinos.org. We encourage you to go ahead and start looking at the grants that are available. We have, and one of the other things that federal agencies do that I think is not necessarily always in our benefit is that they do prioritize municipalities over community-based organizations. And that's because of Congress a lot of the times. And municipalities tend to be the reason why a lot of our communities are disadvantaged to begin with. So the grants that we're reoffering are supposed to be intended for CBOs. But there is that opportunity for us to start thinking about how we become more present, in the space and the connection between mental health and improving our environment. Whether it's at the advocacy level, whether it's on like what we can do on the local level in our community, the impact can be immense, as I discussed with these statistics. And I think trying to incorporate that into our everyday life to de-stress, right? When we de-stress and we have trees in our environment, it also improves the crime rate. We know right now in our cities, in these big urban cities like DC even, that the crime rate has spiked after COVID, right? So one of the ways that we can go about this is trying to invest in trees, trying to invest in combating extreme heat so we could all take that breath of fresh air, calm down, and be more strategic about how we engage each other in a more personal space.
Thank you, Joan. I'm going to actually stay on that thread about what we can do, partnering with community-based organizations, and also sometimes there are reasons that federal government grants out to states and local municipalities, and there's space for partnerships there. So sitting to your right is someone who actually used to work in Montgomery County as a climate change officer. And I wonder if, especially when we're thinking about these unprecedented opportunities for investment, still the gaps that have persisted, some of the systemic issues that have led to the disparities we see in local communities. Adriana, if you could talk a little bit about what you saw in your role as a local climate change officer, and maybe some of those connections and how we might find some of those solutions in the work that we're all doing here.
Yes, thank you for that question. But just for a moment, going to your wonderful tree stats and your call to action to incorporate this into our everyday, I just wanted to share that I usually bring my lunch into work, and as I'm waiting for my lunch to heat up in the microwave for those 60 seconds, I try to look at a window and just look at some trees. So it's nice. It's a lovely 60 seconds. So yes, I did serve in Montgomery County prior to coming back to EPA. And in one of those roles, I served as the county's first climate change officer. And one of the neat things about getting to work at the local and county level is that you see things very up close. Both the challenges as well as the opportunities to intervene and put in place those place-based climate solutions. And we see, firsthand with our eyes, how climate change is impacting, the places that we call home. There was a September day in 2021 where there was an extreme flood event, over 3 inches of rain falling just a few short hours. It was kind of one of those cloudburst events. Just a lot of rain in like a very small area of the county in the Twin Brook neighborhood. For those of you who are familiar with Montgomery County. And that flood took the life of a 19-year-old member of the community, Melkin Daniel Cedillo. And this happened only about a mile or two from my home. And it was devastating on both a professional and personal level to see the impacts of climate change to people who are our neighbors. After this flood, I worked to establish a cross-departmental work group of county departments that did a review of the governance and the gaps in the county's stormwater and flood management regulations and practices, because we want to be able to prevent something from this from ever happening again to another member of our community. As a result of our effort, we were able to successfully apply for some federal funding to conduct what's called vulnerability assessments of other locations around the county that are particularly prone to flooding and that have a high level of social vulnerability. So that work is underway as we speak. Something else that we did in the county is the county had a very ambitious greenhouse gas reduction targets to get to zero greenhouse gas emissions by 2035 with 80% reductions by 2027 from a 2005 baseline. So it's a very aggressive goals. And one of the things we try to do is to tackle some really tough problems that perhaps others haven't solved before, and we wanted to be able to serve as a model for the, help other communities who are also struggling with these issues, kind of help pave the way with some solutions. So there's some really interesting stuff happening around community change aggregation, which is a way that the community can procure more green power, building energy performance standards to improve the performance of large-scale, commercial buildings, as well as there's a lot of work underway around residential electrification, particularly in low-income residences, and also tackling the issue of, being able to provide those basic repairs in homes so that then those homes can get the solar panels, can get the other upgrades that they so badly need. And so the county has been doing some great work, kind of cobbling together funding from lots of different sources to be able to make that kind of thing happen.
Thank you, and I think that speaks to the importance of having folks like you in positions as a climate change officer, connecting those dots and providing that leadership. So thank you for your work there, and then also coming back to work here. Lily, I know, and I'm actually going to change to provide a little time if there are questions in the audience before our panel time wraps, but on the workforce issue, that's been extremely important, and if you could speak a little bit about the efforts around workforce and diversifying our workforce. It's been kind of a theme throughout our day as well, but how that does connect to climate change and environmental health in the work that you're doing.
Sure. I think, so I've been taking some notes. I just want to say, not related to anything today, but can we just get a recognition of not only does our colleague up here bring cool facts and stats, but cool shoes. So I think that yes, see? I thought it was fun. But let me switch to something more serious. The just transition. How many of you have heard that phrase before today? That's what I thought, and I wasn't sure about that. So the first time I heard about the just transition was in Colorado. Take time after today on the break, write it down right now, text yourself, remind yourself to take a look at what is the just transition, and familiarize yourself with this language. And I'm going to come to the workforce and why it matters and representation matters in just a minute. If we don't even know what's being discussed, we don't know what stance we have on this as voters, as panelists, as somebody on the train having a conversation, as leaders in the community. So we need to familiarize ourselves with what is being discussed to show up at the table and have that position and stand for your values. One of the things I've also learned through the just transition related to workforce in Colorado is that there is a separation of understanding the transition for work. So looking away from those who have done mining for years and years and years, finding themselves out of work. This is a very highly divisive issue in local communities. And what I hear from local elected officials is that they're frustrated and angry because their people are being put out of work. And so that means that we have work to do to advise, what does the new workforce look like? What are the new opportunities available? Why does that matter to you as an elected official? And that puts the burden back on a lot of us to do that education and that conversation, not just in the federal government, not in local government, but to grab somebody from Green Latinos, to grab somebody from the EPA and build these coalitions and say, will you join me at a meeting with a local mayor who says that his folks in his community are highly depressed, they're experiencing some mental health issues and they don't know how to cope with it. Plus there's a cultural component to saying mental health out loud. If you look at those who have done this hard labor, they oftentimes were born of the generation that says, mental health? Pull yourself up by your bootstraps and go to work tomorrow. You're not going to be worrying about mental health. That's a generational thing too, and we need to level set that generational conversation to say, let's have a conversation about why our young sisters and brothers and folks in the younger generations are talking about, I'm hurting, I need to have somebody who looks like me, who talks like me, who understands my culture, who understands my walk and my talk. And then older generations saying, I still don't even understand what you mean, mental health. And so Secretary Becerra has led on this work of saying, let's increase our diversity pool. Let's go to the universities. Let's go to the universities who focus on diverse community membership coming into their freshman courses and classes. And let's make sure that there's also a safety net to say, Latinos don't usually stay through that second year. The freshman year is the hardest. Why is it hard? Because they often don't look across the panel and say, oh my gosh, you look like me, you talk like me, you have a beautiful accent like me, and you're not afraid to say it out loud, and you're not afraid to say, I don't know what I don't know, but I feel comfort in knowing that somebody else is here. So part of our work at HHS, back to the workforce component, has to be on the ground. So I've been joined by our Deputy Chief of Staff, Angela Ramirez, in Colorado, and what we did is we said, let's go to the folks who need to understand this. That's higher ed. So one of our universities there has an increased access through local legislation in Colorado. DACA students are often on campus. It's called a commuter campus. I went there. My son went to the other university on campus. He was the mascot. That paid for the books. I loved it. He hated it. He came home reeking of sweat. And he used to say, oh my God, how much longer do I have to do this? And I'm like, till those bills are paid. So we got him through his 4 years. But again, every generation needs to see that increase. And number one thing that we need to do is level set, what are those jobs? Can you get stackable credentials to be a behavioral health specialist? Can you be a peer counselor? Can you be on a 988 call? Can you be talking about support systems for decreasing overdose prevention? Can you be an expert in this? Can you be a promotora? Yes, we all know that word. We know that promotoras are out there. We know that promotoras verdes are out there. They're talking about the environment. They're experts. So let's again translate that into what we see in the 2-year degree and the 4-year degree and the credentials. Ask your employer, can you pay for a certificate for me because I'd like to enhance my skill set for you, but I need some help here. And if you don't have an employer that appreciates that or will pay for that, let's have conversations about what employers do. And that's the work that we've been doing at HHS, is getting out higher ed, business, the chambers, the faith community, the interfaith community, the CBO, the nonprofit community, to say we're going to level set this conversation. And as President Biden said, our work is not done. We've got more work to do.
Thank you. I love that. And, I think of your son, mine is 2, so I have some time, some work ahead. I'm trying to get some tips there. But just thinking of bridging our generational understandings of these issues as well is so important. So looking at that language, looking across the different states and regions and communities, and especially all the different places from which our communities immigrate and come here and thrive. So I want to turn, actually, is that my 2-minute mark? Okay. If anyone had a question that you want to pose to our amazing dynamic panel, we have covered everything from extreme heat and wildfire smoke to higher ed to transforming the way that our grants and investments are made in our communities. If anyone wanted to share a question, I want to turn to the audience before turning to some of the closing remarks. I think we're having a microphone. Dr. Rios?
Dr. Rios with the National Hispanic Health Foundation. We are very interested in environmental health workforce. Just like we need to be representative. And for us, the leaders and the role models within environmental health need to be more Latino. And hats off to all of your work to help our communities, but we also need the leadership. And any thoughts on programmatic support for leadership development in this new space, given the IRA, and I have to say it's a great time to start thinking out of the box about workforce. And I'll just say public health workforce. Everything you're doing is public health. So how do we get more workers, and I don't say workers, how do we get more employees to think about leadership careers in public health departments like HHS, but also city, county, state, that can help move the needle on educational programs for environmental health.
Thank you, Dr. Rios. I'll pop in with just two quick initiatives that I know are taking place, and then see, Lily, if you have anything to share there. So thinking about the entire pipeline of environmental health workforce, we're working with our Office of Climate Change and Health Equity to make sure that we train existing workforce, and that is helping inspire, especially Latinos and Latino-serving physicians and environmental health, public health professionals. At our National Institutes of Health, there's 2 programs. One is Climate Change Scholarship Program, and an Environmental Justice program also just launched. And welcoming people in from, I think, what some people call non-traditional pathways, but really we know that so many people have expertise through all their life experiences, and so that particular fellowship, making sure that in our research we reflect and build this environmental health workforce, especially ones that come so inspired and ready to work on behalf of their communities, and for which they see environmental justice as really the ultimate goal. So Lily, you have anything to share?
I think the only other thing I'll add to that is the same community where the elected official was saying that his community members were feeling a sense of depression because they felt like they were being put out of work. My brother was down there in that same community installing solar panels. And my nephew just got a degree out of Colorado State University for construction management. So twofold here. He's showing up, and he's in a leadership position now through that degree. And yes, we do know that the biggest barrier, removing barriers, Secretary has said oftentimes is our mission here. The biggest barrier for advanced degrees is access to funds, money. and the fear of accrual of debt. So want to call that out, and there are lots of avenues through HHS for debt removal. I don't want to overpromise, but let's have that conversation about the Health Service Corps. But then also I would say that the construction industry does experience a very high rate of suicide. So my cousin is actually leading a construction company in Colorado. He's normalizing conversation around mental health. So the normalization of these conversations in our culture, in our community, is highly important. And then also looking to boards and commissions. So that was the one other thing I was going to mention, is that we ask you, number one, you were asked to tweet something out, put it on Instagram, put it on Facebook, whichever avenue, Threads, I'm not on Threads yet. Use the hashtag. Say that you were here. Encourage people to show up at the CDC, at the NIH. Look for the entry-level positions if they don't have a degree. And also, let's put that out of our heads. The Latino community tends to do this, and especially women. We have statistics to show. We look at a job and we say, oh, I don't meet that, I don't meet that, never mind, I won't apply. Apply, apply, apply. Latinas are also have a pay gap, so apply to the federal government. Show up and get an entry position and understand the navigation you can have being at the federal government to be representative of your community, whether that's a geographic community. We heard from Sandra in New York, Puerto Riqueña, or if you're in Colorado and you've got Spanish blood, or if you're in California and you're Mexican-American, Tejanos in the audience. We want to make sure that we're hearing these different voices and that they're showing up in the spaces where they need to be. And if you have a board or commission that has an open spot, encourage someone to apply and have that voice at the table for the C-suite too, for C-suite and boards and commissions. Long-winded answer, my apologies.
No, I do know we're at time. I just want to look to Catalina as well, that I know for the leadership, there are so many examples coming out of California. If there's anything you want to highlight before we, is sort of, what you see as some examples of success, maybe some lessons learned, really great examples of workforce and reflecting the diversity of our experiences, but I want to make sure and share that.
Yeah, there's so much incredible work going on in California, and in response to the question asked earlier, I think that's another way where we can think more transformatively about, yes, we have to transform our energy systems, our transportation systems, but we also have to transform our agencies, our government agencies, and who does that work. In California, environmental justice communities, advocates have been really successful and have pushed the state to do amazing things because they've realize the legislature, our agencies, our governments, they need to reflect our communities so that they understand inherently the concerns that they have. So there's lots of amazing work in California. In Los Angeles, there's amazing organization, PSRLA, that's stopping oil drilling. Black Women for Wellness is working on chemical exposure specifically affecting women. In California, there's resilience hubs being built. They're focusing on replacing polluting vehicles for electric vehicles and targeting those vehicles to people who need them the most, to heavy and medium duty vehicles that will have the most impact on pollution. In LA County, youth are speaking up about their mental health. So lots of great tools in California, like the EJ Screen tool. It does include cumulative impacts. Our federal tool currently doesn't. California also has federal minimum funding requirements. So for disadvantaged communities, they're required to provide at least 35% of funds have to go to these communities. And in California, state agencies exceed that. But they're still working. I think some of the biggest challenges is in making all these new programs accessible and not making it overly complex or too difficult for people to access. And really just transforming the way government includes communities and listens, allows communities to participate, impacted workers, communities that are having those adverse health outcomes.
Thank you so much for all the work that you're doing, and there is so much work to do. Please consider everyone on this stage as partners. I know we're heading to lunch pretty soon, but please connect and build with us on these issues. We'd love to learn more about the work you're doing as well, and just appreciate the leadership here and doing everything we can to protect our health, our environment today and in the future. Thank you so much.
right, we have one more amazing keynote speaker before we break for lunch. But before we do that, how about another round of applause for our all-women panel there on community health. The next speaker is going to be, his topic is Juntos Podemos, and he's going to be talking about Latino behavioral health and wellness. And so Mr. Fred Sandoval is the Executive Director of the National Latino Behavioral Health Association, NLBHA, but he has over 34 years of professional experience in the health and human services space. He's a champion for the Latino community and for behavioral health issues from both a personal experience that has inspired his advocacy in this space for so many years. He has, again, over 3 decades of experience in this work. He's also served the Department of Health and Human Services here at HHS. He worked with SAMHSA, where he's advised us and been a consultant on ways to outreach to Latino communities, uninsured, and other efforts here at the department. He was formerly appointed by Governor Bill Richardson of New Mexico and served as Deputy Secretary in the state of New Mexico. He has also been first Vice President for the National Alliance of Mental Health Illness here in the DMV area, and a ton of other efforts, including at the local level in New Mexico, where he served locally and again at the state level. But again, most importantly, he's going to talk about what he's seen from his perspective, 3 decades of work in advancing behavioral health and substance use abuse efforts to address many challenges that we know all too well. Many challenges with mental health are all too persistent in our communities. And so you've heard about our 988 hotline. He'll talk a little bit about that. And then most recently, we've made some gains with parity here at the department at HHS under Secretary Becerra's leadership. So that idea that mental health and substance use disorder treatment should be at the same level provided as any other mental condition. So with that, and my pleasure to bring up Mr. Sandoval, our next keynote speaker. Fred?
Buenas tardes. Otra vez, buenas tardes. Oh my God, you know what it's like to be in this position right now? You are hungry, and I am too. So that means 2 things. You're anxiously awaiting that wonderful food that's in there, and that food happens to be medicine, by the way, but more importantly, I'm here to just impart some things that I've learned, which is right about 40 years of having been in behavioral health. What I want to do just very quickly here before I go through just a handful of slides, I'm not going to be going through these huge graphs and data charts. What I'm going to do is I want to spend time touching your heart, checking in with your soul, because the work that we do in this country in behavioral health requires a mastery of that. And so I want to just share a little bit about my sister, who was diagnosed with chronic paranoid schizophrenia while she was in the United States Army. She was medically discharged, and for 10 years, my sister suffered seriously. In and out of state hospitals, detention facilities, living on the streets. She'd been sexually assaulted. She had her checks stolen time after time, in and out of apartments. And then, lo and behold, in one of those hospital visits, she was pregnant. I'm a policy advocate so people like my sister don't have to suffer, because that suffering is what makes this condition so significant for those of us in this field. All of us know that. But I want to just be able to kind of reflect on the fact that in these worlds that are challenged by this notion of the brain, what we also know is there is hope in this work. As a community mental health director for many years, I would say to staff, and I would say this because it was something that my mother influenced me by. My mom would say, "La esperanza es la última para morir." Hope is the last to die, my son. And I believed it. And I believed it so much that as a mental health director, I made it my mission to instill hope in every person who served others who were suffering, and then others who could potentially die. And I just want to recognize your comments earlier, because today I'm going to be talking about the very things that do instill hope, invigorate this notion of how we can help and heal others. And so, as you know, Hispanic Heritage Month is about how do we, in fact, recognize what's unique to the Hispanic community, as diverse as it is. And the Juntos Podemos theme, right? Juntos Podemos means together we can. So each table here, each row here is full of people that can work together and have worked together and have yet to work together. But it's going to take each and every one of us to do it together in order to have the impact that's needed in this country. And the reason why is because all of us here would have something in common. There's a unanimity amongst us, and that is we all want to reduce the human suffering of people with mental illness. Would you agree with that? Would you agree with that? Juntos Podemos, and you know why? It's going to take everyone imaginable that's part of this system to fix what's broken, and then find the new things that can help us address the disparities that exist. Because today it's not about the disparities. My comments are really going to be about what it is that has been working for so long, and we have somehow overlooked it. And when we overlook it, what it does, it actually does something to the Latino community. It does harm to us. We have to reflect on how it is that culture is so significant to our work that if we dismiss it, we in fact will very likely do harm. So let me just share a few things to help really reinvigorate this notion of hope and how it is that we can actually be of service to the Latino community. But let's give a big round of applause to Secretary Becerra and his team for putting together this summit. Let's give them a big round of applause. This is the 2nd annual, so I want to come back when it's the 20th. And I'm not going to tell you how old I'm going to be when I get there, but I promise to be there, only because this is a lifelong passion of mine. This isn't something I'm doing for 3 or 4 years that's going to look great on my resume. This is a lifelong passion. If you have that lifelong passion, you are the partner that's going to help make the changes necessary to help improve this system, because we all have that in common. So, as I said before, as a partner, all of us know this. And then I'm going to have somebody translate this for me real quick. Una mano lava la otra y las dos lavan la cara. So my compadre Guillermo, I'm going to ask him to just translate that for us. And you can use an outdoor voice. And not that Guillermo has to do that, by the way. But if you could just help folks understand what that dicho is. Una mano lava la otra.
One hand wash the other, and the two wash your face.
That's right. So, Juntos Podemos, ¿verdad? We're going to do this together. So, with it being National Hispanic Heritage Month, what's really beautiful about this experience and this occasion is, of course, this. Is we get to be proud. This is such a prideful moment for me. I've worked in this business for 45 years. I've helped save many lives, but I never forget the persons who I've touched in that 45-year period of time. And you know why? Because many of them were from the Latino community. And those families and those kids that are now adults remind me of the fact that I helped save their life at one point. Wow, what a powerful message that is. But why do we do it? Because we care. We're empathetic, and more importantly, we're committed to help individuals who are suffering. I'm going to take you back in time, and you figure I'm going to do that in 15 minutes. Now make it 12. I'm going to tell you what happens. In those years of behavioral health at the very beginnings of the Mental Health Act, the Latino community started talking about, well, how do we take care of ourselves? And over time, we created messaging that was appropriate. So the messaging that was early on created was called La Cultura Cura. Culture heals. And does it, in fact, heal? The word is absolutely yes. So what we know is this, is because culture is at the very foundation of what is important to the Latino community. It's also the roots of our community. And because of that, it is such a perfect point for recognizing how to engage with us, how to intersect, how to communicate with our communities, because guess what? The trust that we are all looking for is going to come from your understanding who we are, whether you're from Puerto Rico, from Cuba, from Mexico, Nuevo Mexico. And incidentally, my family's been here in this current country before it was a country, and before it was Mexico, and before it was Spain. I was part of a nation called the Anasasis. So my family has deep roots dating back to 1540. And that means I have deep roots here, right? Because the very lifeblood of the Latino community is that important to who we are. And because of our heritage, our history, and our culture, it is who we are. So I want to certainly recognize this. More importantly, is there's so many attributes to the following things. How food is, that it's medicine. And as you can tell, I have photographic images because when we think of these kinds of images, there is a connectivity oftentimes people don't recognize about what we eat, right? El maíz, as we say in New Mexico, the spiritual connection we have with corn, cornmeal, corn products. Those are a spiritual nature. We understand the nutritional value. And in fact, it's the one plant where the human and the plant are symbiotic. Their connectivity to each other means that our healing comes from a very deep place. There's something called heritage corn. It's still grown in the Southwest by the Anasasis. And that heritage corn is what? It's the very same seed that was growing corn 10,000 years ago. It's the same corn from 10,000 years ago. And when you consume that, you consume the very spirituality of the life cycle. It's a powerful and deep thing. And that connection to our culture is just that deep. So for us to overlook culture and engaging with Latinos would be a serious mistake, and oftentimes can result in harm. But what's important is that the medicine that we take because of the things that we eat is so critical to our experiences, right? La cocina. What's the most important space inside of a Latino home, typically? The kitchen, right? Can you remember your grandma wearing her apron? Or your mom? Or your tias, right? And that was where you got the best chisme, right? But not only did you get the best chismes, that's where you got the best advice. These traditions are so old that it helps us learn the practices, the methods, the techniques, because in fact, culture is a learning environment. And what's important about it, it'll help us engage with the Latino community even more than we've ever been able to do that. And we also recognize, because it is medicine, it reminds us of something about all of our roots. All of us have agrarian beginnings. We have lost and forgotten, oftentimes, our agrarian roots. Because today, it's the farm workers who every day remind us of that. So during the lunch break, when you're consuming food, think about the person who grew it, who picked it, transported it, and made it available to us. Let's honor them, because without them, what would we do, right? So A Life on the Land is a story about my father, and I'm not going to tell you about that story other than the fact that it's so deep in us that it's the value and the respect that you give our culture that increases our trust in working with you. Let me repeat that. The value that comes from respecting our culture is what increases our ability to engage more effectively with you. In the absence of that respect will be the lack of trust. And in the business of behavioral health systems, without trust, there's no acceptability of your service. Remember the 6 domains? Acceptability is one of those. So I'm just going to kind of head here towards trying to make sure that everything about our culture is medicine. La música. Anybody want to do a little baile right now, right? Una pachanga, right, as the secretary said? Because what happens is it's good for us. It's good for our souls, good for our bodies. It's vibrant. What it does, it's part of our health and well-being. So we know that because music is just like that, we incorporate that in most of what we do. just like the bailes that my comadre was talking about, the music that she was talking about earlier. But this thing about dance is also medicine. The thing about the dance is what? How many of us enjoy that? All of us like it somehow. Remember when you were 16? Nobody wants to admit to that. It's okay. Okay, 21. Let's go with 21. About a month ago, I had a woman, she was in her early 80s, and she was in a wheelchair, and she came with her husband and her daughter to watch a concert we put on by Little Joy La Familia. And she got up off her wheelchair to dance with her husband. And the daughter was in tears because it had been months since they had left the house, and it had been years since she had watched her mom dance with her husband. The connection of these acts, these intimate behaviors, are what make us feel better, are good for us. It is medicine. The medicine I'm talking about is what heals us, right? Not the medicine of the pharmacies. And what's important, of course, is that those are forms of treatment and medicine. But the medicine that I'm talking about is the healing power that comes from our culture. So just if I can, I just want to highlight this as I start to wrap up. There's so much that dance has proven to work, and we also know how plants are so significant. Anybody like tea here? Raise your hand if you like tea. Well, welcome to medicine. In part, this very book that I'm pointing out right here, it was originally written in Nahuatl, which is the Aztec language. And then what happened, it was called the Little Book of Medicine. That book ended up in Europe and never to be found. And then Pope Paul came to Mexico, and what did he bring back? He brought back the Little Book of Medicine in its original manuscript. Keep in mind, ever since then, it's been translated to what? From Nahuatl to Latin to Spanish, and now in English. The medicines there are the medicines of today's modern treatments. And those origins are where we are found, in this historical place of our heritage plants. So as I really kind of wrap us up here, I obviously want to just kind of highlight this. La Familia, so powerful. And right now we're experiencing so many challenges with keeping our families together for all the reasons we know. But I would simply say this, because they are the cornerstone of the Latino community, it's important for us to recognize that the family is struggling to stay together, but together we are stronger. And these families that I'm referring to are families like mine, like yours, the communities you serve. But the very essence of that family structure, you have to know intimately in order to be able to engage the families to effectively help maintain our wellness and help increase the likelihood of accessing your services. So what I wanted to just say is there has been lots of progress, and I just want to highlight a few things because it's important for recognizing that in our system of care, we have in fact done some really good things. So we got to give ourselves credit for that. This is incremental work, it's policy work, but at the end of the day, does it improve the health status and well-being of the Latino community? So we know this for sure. Much credit to the Department of Health and Human Services for helping facilitate through the Substance Abuse and Mental Health Administration the first Hispanic Mental Health Congress. So now that I'm hearing a health summit almost 25 years later, you imagine why I would be excited, right? But the very beginning of that was many years ago, and it preceded many of you that are in this room. We don't want to lose the origins of that information because of its value. Dismissing it or not understanding it or not understanding that it exists can have detrimental impacts on understanding effective policies and approaches. Parity, we now for the first time can recognize that of the two major federal legislations on parity, we can now finally start to dissolve the problems we had with the challenges of having coverage that treated health and behavioral health equally. We also know, and much credit to a colleague who's in this room right now for helping the Office of Minority Health develop the class standards, which were subsequently enhanced. My compadre right here, Guadalupe Pacheco, let's give him a big round of applause. As a leader in the field, that work still needs to be enforced. And I have borne witness to when it hasn't worked, and I have also witnessed how it is that we can support ensuring the language access to the very services, which has led, in fact, to the department's new language access plan, and talk about a monumental document. You have to read it and use it, because what it means is to address disparities and achieve equity. It's taking these policy instruments into consideration. And I'll end with this. The 988 and the crisis text line, I have a colleague sitting right here. I'd like you to visit with her. I'm going to ask her to just kind of wave her hand. And I want you to visit with her. And the reason why, they have a report on the use of the crisis text line by Latinos in this country, and you will be blown away. So when you look at your device, you're going to think differently about what it is that our kids are doing to reach out for help. When they don't come to the parents or the godparents, they are reaching out for help. We are in a new generation in time, and it's up to us to recognize that because we love our children, we're going to help access resources to them. The last thing I want to share is the President's Unity Agenda is addressing the mental health crisis in this country. And you know what I like about that? We admit our failures, but we proceed to have a plan for how to fix those things. And when we don't recognize what's wrong, what are we going to fix? But I'm going to leave you with this message. La esperanza es la última para morir. And because hope is the last to die, we have lots to look forward to. Each one of you has a reason why you're in this work. Each of you are impassioned to get up every morning or to take that 2 o'clock in the morning call, because guess what happens? The people who are suffering are trying to connect and bond to someone. We are those someone. And what I want to say is, I want you to give yourself a round of applause for all the work you've done throughout your career to be here to serve Latinos in our country. So thank you very much for these short comments. Take care.
All right, please, one more round of applause for Mr. Sandoval, El Mero Mero. Thank you so much. All right, so now this is exciting because we're the federal government and we rarely provide food, but today we have food for you all. It's Puerto Rican food. It's over in the East Room, so please help yourself. Again, restrooms are to my left. The food is to the right. We'll reconvene at 1:20, so please feel free. You can eat in here or over there. There's tables as well. Be back at 1:20, please. We have a great lineup after lunch, special guest speaker, as well as a panel on reproductive rights. So we'll see you then. Enjoy lunch. Thank you. Oh, sorry, one more thing. There's also resource tables. Please, as you're grabbing food, we have the Agency for Health Research and Quality, AHRQ. We have HRSA, Human Resources Services Administration, CMS, SAMHSA, the Office of Behavioral Health Equity, and the 988 team, as well as ARPA-H in the East Room as well. So please stop by the resource tables. Thank you so much.
Produced by the U.S. Department of Health and Human Services.